Glad to be here.
All right, so good morning, everyone. Happy Friday.
Good morning.
Good to see everybody here. I appreciate people who are attending in person. It's good to see people, and thank you for everyone who's attending online. As we start the meeting, I had a couple of texts from Ashley Lowry's on her way, right? And Dr. Freeman, who helped author our PIT report, is on his way and is running into just a little bit of traffic. So that's okay. We will continue on, and there are some things that we can discuss briefly as we wait for Dr. Freeman, because he's early on in the agenda. So as we start and you look at the agenda, we really want to be very intentional about recognizing what our priorities are, our priority populations and interventions. So I just want to go over that briefly so that it's always front and center about why we are here and who we're focusing on. Certainly anyone who is facing homelessness or experiencing homelessness is a priority, but we have the vulnerabilities and or at-risk factors include certainly life-threatening health conditions and accessibility conditions, severe and persistent mental illness and substance use or substance disorder, domestic violence within the past 3 years, a risk of harm or exploitation, and length of time in homelessness. Our priority populations are disproportionately represented minority groups, veterans, families with minor children, older adults age 62 plus, chronically homeless households, and youth 18 to 24. And all of those priorities are reflected in the data, and you'll see that in our PIT report as well. Our priority interventions, clearly prevention is front and center because it costs far fewer dollars to prevent homelessness rather than to address it if someone's experiencing homelessness. Invest in securing and maintaining emergency shelters. Invest in rapid rehousing and wraparound services. Again, data shows that works. And set long-term goals for permanent supportive housing capacity. And so it's just important that people realize that that's the focus of the CoC. We vote on those priority populations and interventions. And those of you, particularly elected officials, communicate that with your constituents and your peers. Okay. So the second part before we do a roll call is some special recognitions and appreciations. And I just wanted to take a moment. First of all, I'd like to thank our Lived Experience Advisory Committee. They meet monthly and they met last night. I attended that meeting. We have the co-chairs both here. Michael's here and Gary Small, Mike Crichton and Gary Small are here, the co-chairs of that committee. It continues to be a robust committee. They finalized their charter that's in an alignment with ours last night. He approved a phone tree that they're going to be working on for members of their community to reach out in times of crisis, like hurricane shelters, cold night shelters, things. And they're talking about ways to incorporate storytelling into educating the community about homeless experiences in Pinellas County. Did you guys want to add anything else about last night's meeting?
I mean, pretty well covered it, but it's in hope of reducing the stigma that the general public has about people who are experiencing homelessness. It could happen to anybody at any given point in time. Take 4 paychecks out of their bank account. What?
Exactly right. Yeah. Increase in insurance cost, a special assessment of where you're living, all that stuff. Increase.
Have a car breakdown. Very.
Okay. Thank you, Gary. Also want to thank a special thank you to our CoC's pro bono legal representation, which is the Stinson Law Firm. And in particular, Attorney Murray Silverstein and Greg Payton have helped us extensively, the CoC Executive Board or Executive Committee, with our revisions of our MOU, which has been going on since February. as well as our conflict of interest statement. And just incorporating some best practices and having another set of eyes on those documents. Those revisions, especially for the MOU, are included, and I'll talk about the conflict of interest statement and policy as we get further down the agenda. But really, special thank you to Murray and Greg for their help, as well as Doug and Cooley, who used to serve, be part of our Continuum of Care board and was the Funders Council Chair. Duggan is CEO of the Pinellas Community Foundation, and he helped facilitate those MOU meetings between the HLA board and Sherry, as well as the CoC Executive Committee. And that was a lot of work and coordination. So thank you to the HLA board members, particularly Kimberly Rogers and Pamela Qualls, who worked hard on finalizing and getting our MOU document strengthening it. So I appreciate that, as well as all of our members of our executive committee who worked on that. So thank you for that. All good? Sherry, any recognitions or appreciations right now before we move on to roll call?
Yes, I have. Well, first off, I really do apologize for not being there in person. I hate it, especially for today, because I have some news to share about Victoria. And Victoria, you're in the room, right?
Yeah, I'm here.
Okay. I wanted to take a moment to recognize Victoria, and who's been with the HLA for a little over 4 years now, and she will be leaving us at the end of the month. And so we are just, all of you who know her, you know her passion and her dedication to our mission, and we're going to miss her. We are going to miss you, Victoria. But then I hope that, and I'm counting on your continued participation in the CoC. So just because you're not with the HLA doesn't mean you get to leave the whole family or the work. So I want everyone just join me in thanking her for her time and her commitment over these past few years, and for the best wishes moving forward. Thank you.
I would say in particular, Victoria worked so hard in getting the Lived Experience Advisory Committee up and running 2 years. And they had a nice send off for her last night. I'm very surprised, but very appreciative. So thank you for leading that. I know your heart's there. You can just feel it in the room. So thank you.
Thanks, everybody. Thank you. It's been a really busy 4 years, that's for sure. And I have really absolutely enjoyed working at the HLA and with the CoC. This has changed my life in ways that I can't express. And yeah, being at last night's last league meeting was a little emotional for me. We celebrated our 2-year anniversary on the same night that I said goodbye. And so I'm grateful for what that group has done. I'm grateful for all of the work that we've done on the pit over the last several years. Cold Night Shelter is one of the coolest things I've ever been involved in. So thank you, everybody. I really appreciate all of your support over the last 4.5 years.
We wish you all the best. All the best. Anything further, Sherry?
I just want to take a moment to thank everyone who was involved in the pit report. Of course, Dr. Freeman, Gerhardt, and all of the input that other board members and committee members provided in the making and design of this report. HMIS team, Victoria, several people, a lot of groups got together, and there were every Friday hour-long meetings, and then sometimes going late into the evening to just get this report right, because it was a later release when HUD opened up reporting, and so that took some time away, and then to get all the data together. And I'm grateful that everybody showed up in July. This is the first time that I'm aware of. I going back a few years at least when we're talking about Pitt, where we've had quorum in July in order to present this report instead of in September. So very, very, very appreciative of that because so we can move on with all that work around strategic planning going into the fall and reviewing the governance charter and the elections and all that other work that we have. This will help keep us on track. Thank you. That is all.
Okay,
Thanks.
all righty. I think we're ready for the roll call attendance.
Kathleen Beckman,
Present.
Councilmember Deborah Sanders. April Lott, absent today. Michael Cretin. Janina Voley,
Present.
Lieutenant Zach H.
Here.
School board member Laura Hine,
Present.
Commissioner Donna Holt,
Present.
Michael Gelazzo,
Here.
Teresa Jones,
Present.
Lawson Capper, Ashley Larry,
Here.
Councilmember Mike Menino, Kevin Morrell,
Present.
Esther Matthews, Elise Minkoff, David Moran,
Present.
Sandra Newsom. Sandra, I do see that you are online.
Present.
I'm here, present, sorry.
Thank you. Commissioner Vince Nowicki. Sam Picard,
Here.
Ross Silvers,
Unmute my microphone.
Here.
You are unmuted. Mute my mic.
Gary Small,
Present.
Danielle Thomas, has told me she would not be here today. And Anne Marie White here. Yep, and we do have 4 on that 19.
Fantastic. Thank you. Well, thank you for attending, especially in July, but I think with the hybrid, there's, it's easy to attend. But people are also entitled to go on vacation. All right, we have the consent agenda. Hopefully you looked it over, and do I have any amendments or a motion to approve the consent agenda? Okay, I'll second. Move in second, right, thank you. All those in favor? Any opposed? Thank you. I'm gonna say just one thing though about that consent agenda. I would encourage you to look at the meeting minutes for the last Continuum of Care General Membership Meeting. We had it at St. Vincent de Paul Soup Kitchen in Clearwater. Chrissy Bond gave us a tour, and then we broke out in work groups. And in the appendix, with the onboard platform for our agenda, in the appendix are notes from the breakout activity, and people gave information. We all collaborated on what services and strengths already exist in our community, who is currently at the table in the CoC efforts, who is missing, what partnerships or collaborations are working well, what are the opportunities, and what support is needed to strengthen these connections. It really is just a nice, easily read bulleted list. I would encourage you to take a look at it and see if you agree. And it ties into a little bit with the recommendations Dr. Freeman or Dr. Gerhardt has with the PIT account or the PIT report. So take a look at those and see where you might fit and if you'd like to comment.
Kathleen, which document was that again?
It's the CoC general membership meeting. We had it
Minutes that are
in the minutes, yep. Mhm. Okay, all right. Oh, goodness gracious, still learning. All right, so I have a little reminder from Victoria, thank you very much. Board members who are online, make sure that you turn your cameras on, please. That's part of the policy. And I didn't ask, or we didn't pause for the vote online. I apologize for that. Do you want me to go back for that, for the approval of the consent agenda?
If there's any, board members online, yes, please,
Indicate approval or
take
not
yes
of
in
the
the chat
consent agenda.
or use the green check mark in the reactions bar. Or approval of the consent agenda.
I need to remind myself to remind people that that's how they're gonna vote online with that on board. Right.
Ms. Teresa has a question.
Okay.
Her hand is-
Okay, thank you. Teresa, go ahead.
Madam Chair, thank you for recognizing me. Would we clarify how you want us online to vote? Do you want us simply to raise our hand? Or do you want us to do a voice vote? I think we should clarify that.
Okay, thank you. Sam, I have a question here before we get to that. Sam?
I would make a suggestion that in the reactions tab on Zoom, there's a yes, no option. And that's probably the easiest and clearest way for people to vote, because then you can count pretty easily if it's yes or no, and you don't have to do yays versus nays. You can do it all at the same time.
Okay.
And we did do that the last meeting. It worked well.
Is that gonna work for you, Megan?
Yes.
Okay.
Yeah.
And we don't have a visual of the 25 people.
Right.
Yeah, because we're looking at the agenda, so
All
it's,
we see is 4. so-
yeah. In fact, because we all have the agenda in front of us, Megan, can we put the boxes, the Brady Bunch boxes up there?
Yeah, I can take that.
That'd be good. At least we get a sense of. I'm reminded that there are other people here in our meeting. I see you, Teresa. Okay. All right. Thank you. All right. All right, so everybody's got their camera on, especially board members, visitors, don't necessarily need to. All right, we are at agenda, item number 3, our, Pinellas County point in time count report. I'm gonna turn it over to Sherry for the introduction of this incredibly important part of our meeting today.
Okay, yes. So Dr. Freeman has done this report. I believe this is the 3rd year. And he took some time, and I'm really grateful again that it took some time to meet with board members and committee members, anyone in the CoC who wanted to take part in its design and just informing how to make this useful and usable moving forward. One area that I want to point out that I think was very it's going to be very helpful in our strategic planning process, and really went above and beyond is in the recommendations section. There are some long-term and short-term goals, recommendations in there. And of course, he is our data person. He puts all this information together. Those recommendations are then for us to take and digest and figure out, where do we want to focus our energy over the next year to 5 or beyond, and what do we have capacity for? Where do we need to build that capacity? But so those are recommendations that we get to choose from moving forward, and add to if we choose as well. But that's what I want to say, and I want to hand it over to Victoria, because being the last meeting and her incredible involvement with this entire process. She is she is project manager of this report. I want to just hand it over for her to do further introductions and take it over.
That makes me feel like I'm standing up at the podium with purpose. I'm actually just making sure Freeman's ready to go. But like Sherry said, Dr. Freeman Gerhardt has been part of this PIT process for the last 3 years now. And not just as the analyst and author of the report, Freeman has been part of our continuum of care for the last 3 years. Originally hired to do the 2023 point in time report, Freeman quickly joined data and system performance. He started attending all of our point in time meetings virtually because he doesn't live super close, and has been part of our CoC and the CoC's decision-making process, planning process for a few years now. And I'm really excited that Dr. Gerhardt was able to join us once again to put this report together. I think the report gets a little more thorough, which means a couple pages get added every year. So you might see a couple of new things in this year's report that you didn't see in last year's report. I really hope that it's incredibly useful I hope that you ask great questions throughout this process. We have also provided a one-page overview for this year that we hope will be a good reference document for you so that this information can be even more useful, because the goal is for this information, for this data to be as usable as possible so that everybody in our community knows about homelessness in Pinellas County. So with that in mind, and without further ado, I will pass it off to our author, Dr. Gerhardt.
All right, well, thank you all very, very much. And I'm very excited to be here for the third year in a row. And I hope you guys enjoy the report and the presentation, because we have some, I think those of you who have read the report will notice there's some really exciting findings. And, you know, so of course, some findings that I think we need to continue to push on. So I'll highlight those.
All right, we're having a thing. Not sure why my camera's not working. All right. Sorry, guys. I don't know why this isn't working. Megan, can you screen share? Can you screen share the presentation and sorry. Sorry, everybody. Technical difficulties, just to be short. Oh, my screen share is loading.
There it goes.
It was just a Wi-Fi thing. Sorry, everybody.
If I minimize the videos on here for that, up there.
Dr. Gebhardt, make sure you speak loud enough, okay?
Yes.
Thanks. Everybody can see, okay? Do you want me to see if we can? If it helps to. Does that help a little bit? From people here?
Yes.
Okay.
Okay, so can everybody hear me like this and those online? All right, well, I know we're short on time and there's a lot of information to present, so let me just jump right into it. So in this presentation, you know, of course, I'll talk a little bit about the methodology, but really mostly focus on the findings. But I did want to mention, you know, specific in terms of the methodology of the point in time count. HUD requires two counts. So there's the shelter count and the unsheltered count. The sheltered count is annual. The unsheltered count, we do annually, but it doesn't have to be. It's every 2 years. And the sheltered count is going to be referred to as the housing inventory count, you know, throughout this presentation. There's some nuance to that. But if you see the term housing inventory count or HIC, that's going to be in reference to people who were counted as shelter at this point in time. And then the point in time count and survey is actually where we go out and physically count the people and take a survey of some of their characteristics. And then what's extremely exciting about Pinellas, as I learned 3 years ago, is in addition to the HUD requirements, we do the jail count and the Pinellas County School Board. And so the methodologies are slightly different. So with the jail, and I'm sure Lieutenant Hayes will please correct me, it's the time, you know, those who report do not disclose a permanent address when they are being released. And then the school board is a little bit different as well. It's over time, so it's not one point in time. It's from the beginning of the school year. So I believe this year it was August 10th to January 27th. So students who are identified as homeless throughout that entire time period, as opposed to one point in time. And then to look at that, I just looked at some descriptive statistics, and of course, as always, some geospatial analysis to actually map out where people are located. I wanted to just have this up here for people to skim through, because I know last year there was some you know, confusion, I think, on all parts of what exactly youth, unaccompanied youth, parenting youth are. So I'll maybe pose that to you guys before I get started. Is there any questions about some of the definitions? One of the ways, because, you know, even though I've been doing this for 3 years, it can get confusing. One of the ways I like to think of these categories are, there's 3 main household types. There's going to be this single adult, children younger than 18, and then family households or households with at least one adult and one child. Some of these terms like unaccompanied or subpopulations, like unaccompanied youth, parenting youth, etc. Those are subpopulations, so they can be in multiple households at one time. For example, I like to think of if there's a 24-year-old veteran, that person is going to be counted in a veteran household, also going to be counted as a single adult if he or she is single, and then also as a youth because they're younger than 25. So they're not really mutually exclusive. So that always causes some. Okay. And as you can see here, this is the breakdown, the overall, we'll get into some more of the specifics. But the housing inventory count or the shelter count, 1,325 people were identified. The point in time count and survey, 538 were identified, which is a substantial drop from last year. And a continued downward trend, which is really exciting. And I hope to have a conversation about possible reasons as to why that is, because I think it reflects actually some great work by the providers. So that gives a total reported to HUD for homelessness as 1,863. When we look at the jail and the schools, which is not reported to HUD, 125 people were identified at the jail, which is a reduction. So great job there. And then the schools, this is where I think, maybe a conversation is needed where still a relatively high number of students over time identified as experiencing some type of homelessness. And I know it says on the agenda, questions at the end. I kind of like the format of if you guys have a question while the information is presented in front of you, you can.
Maybe just a point of clarification on the school number. That's a cumulative yearly number versus the others that are at one time.
Good, great question. So the schools is the total number of students who are within the Pinellas County School Board. So that's not going to be every single school, but that's from August 10th to January 27th.
But that they filled out a survey and reported at any time during the year that they experienced homelessness.
Yeah, so there's multiple ways. So every year they have the survey where they look at, or it could be their teacher identifies them, or they go to their teacher and say that they are homeless.
I think what Kevin is getting at is that the school count is a cumulative count. So once students get onto the list, and they are surveyed as experiencing homelessness or being doubled up, they may or may not be removed from that list. Sometimes throughout the year, children are removed from the list because guidance counselors are updated and they update that list. But largely, it is a cumulative count and it is not updated throughout the year. So once a child is on the list, they are on the list. And it is also not representative of the entire family. It is representative of that student.
And I'd like to add one more thing too about definitions. So the way that homelessness is defined by the school system would be different. It's under McKinney-Vento, which is different. So doubling up would count as homelessness in that case. Whereas for HUD, literal homelessness is living in a place not meant for human habitation. And so when thinking through these numbers, or this information, making sure that we're not doing those types of apples to apples comparisons, in addition to what Kevin and Freeman have already, and Victoria have already mentioned.
Yeah, it's by no means meant to minimize that
No.
number. That's like an unacceptable number, but I just think when this data gets out to the general population, you want to make sure it's clear and that there's not at any given point in time 3,623 kids on the street. So that all the other numbers are streeter or shelter homes.
Yeah, that's a really good point, and that's something that shows in the report. You'll see. So when doubling up, I'm assuming we're talking about shared housing. So these are people who are sharing housing with other families, and that's by far the largest share of the student homelessness. So HUD wouldn't consider that And I'll show, when I get to that part of the presentation, I'll show you guys some of the figures, or if you have the document open, you could skip to that. But yeah, really great point.
Yeah, I just wanted to confirm, you're saying that that number is just the students, that doesn't include any of the adults in there. And then my other question is it possible that some of those identified there are also in the other counts?
It is, yep. So there's a lot of clarification like that. So there could be, it's shared housing that could be identified, it's duplicated in the count, and it's cumulative, which is really important. So instead of 1 point, it's several months.
Okay, thank you.
I just want to say, I'm so grateful that we include the Pinellas County Schools data. It is incredibly important, I think, that this community understands how many families and children are not living in stable housing, whether they're sleeping on a couch or doubling up. It's not the best environment for that child and family. And we need to know that. And I think by having, you can say, well, a kid might get on the list in August or September, and then they find housing and they're not on the list, but it's only 6 months. I was a teacher, not in this state, but you're aware of families and children that experience all sorts of things that impact their education and health, and not having stable housing is a huge, huge thing. I would think this is a much more accurate picture rather than the last Tuesday or Thursday, whatever it was in January when we do the count. And I would also think that if we can look at the surveys we took on families on the point count day, there probably aren't very many families that are surveyed out in the public as we walk around. And so to think that those people are being counted twice, I think is probably not highly likely, there could be, but I think it's really, really important to, I would really focus on that number. That's a disturbing number, and that's only Pinellas County schools. It's not private schools or other areas. And I think you need to understand that a school is most often a very safe place for a family to divulge that they're struggling and asking for help. And so you might get more accuracy that way as well.
Yeah, I just think it also highlights how different the intervention has to be for this as well, because, they're not sitting in a shelter where you can access, they're in cars or in homes. So the interventions are very different as well. I think the numbers highlight that.
Ms. Teresa Jones has a question online.
Go ahead, Teresa.
Her hand was raised. No.
Thanks, Madam Chair. Actually, I believe that Kevin just touched on what I was going to speak about, is that although those families may fall under the McKinley-Vento definition of homelessness, we still as a CoC can, to customize our interventions to still address them. And we have been doing so through programs like Family First and others to try and assist those families as well. Thank you, Madam Chair.
Well, let me keep, so these are all great, and so up to wrap this conversation up until we have it at the end of the presentation, one of the key recommendations is partnerships, and schools are a key partnership across providers and the CoC as a whole. Okay. So the structure of how this presentation is laid out is I'm going to talk about the shelter count and then the unsheltered count. Then a comparison between the two, then get into briefly the jail and then a little bit more in depth of the school. But so looking at all households and all shelters, we can see that most of the people identify as male, white, and are typically over the age of 45. And this is the general pattern when looking at every single household type across CoCs. But what is the interesting part, and I'll walk you through these graphs, I don't know if in the back you guys can see them, but when you break it down by household type, it's where you start to see some, I hesitate to use the word disparities, but some disparities here. When most specifically looking at family households, these family households are going to be what you see on the screen as households with at least one adult and one child that colloquially is referred to as a family household. And you can see that that is mostly populated by people, women or girls. And actually, equally as important in these family households when looking at race, mostly populated by people who identify as Black or African American. For those in the room, that would be the middle chart right there.
Thank you, Dr. Gubb. Can you, as you look at a graph, can you just read off what it is and point, because I can't read from this slide. Just saying.
So I'll let's go back to the gender. So then looking at the shelter count, looking at genders, we can see, so in the green bar, that's gonna be people identified as female, yellow, male, blue is other. You aren't really gonna see any blue bars here because the other, compared to male and female, the other counts are, about a handful, so it doesn't really show up. But green, girl, yellow, boy, like that. And you can see that households without children, mostly male. And you're always gonna see that there's gonna be a higher count in emergency shelters. There's just more people in emergency shelters, more beds, etc. So households without children, male, households, family households, we start to see the shift. Now it's females, so mothers. And then when you get into the subpopulation categories, parenting youth households, female or girls, and then unaccompanied youth households, you can see actually a more even distribution between the genders. Questions about this? And throughout the presentation, you'll see, so the households are all going to be in the same category. So if you can't see, just I'll continue pointing. Same thing with the race. Now looking at race, green is going to be Black or African American, yellow, white, blue, other. Other is going to be pretty much anybody who is not white. It doesn't identify as white or Black.
There's a laser pointer in this. You don't want that, okay.
Do you guys mind if I point up here like this?
No, it's very good.
So once again, looking at racial categories, so we can see households without children, single adults, so people over the age of 18, mostly identify as white. When we get into the category of family households, you see mostly identify as Black or African American. And now this is going to be the age breakdown. This is the age breakdown based on the priority populations identified by the CoC. This is different than the HUD reporting requirements. So they have, for example, categories 65 plus. We have categories 62 plus. And we also go above and beyond, and you'll see in some of these youth households where we actually break down the younger than 18 category into younger than 5, 5 to 12, 13 to 17, which goes above and beyond almost every other CoC report I've ever seen. They typically stick with just the general younger than 18 and 65. So this is really good work. So we can see that households without children mostly identify, or not identify, excuse me, are over the age of 45. Stretch. And we can see that households with the family households start to skew a little bit towards the younger side. That's because there's children and multiple children in some of these households. And the color scheme is slightly different where we're looking at the different shelter types. So ES up here you may see is going to be emergency shelter, TH in green, transitional housing, and then yellow, safe haven.
Answer your quick question, please. I was trying to follow you since I can't see that far. But the information that's in the packet looks to be a little different than what you're presenting.
It's organized differently. I'm saying the same
I don't, we have the PowerPoint in the.
Yeah, we don't have it, and I can't see that, so you're talking and I can't see any of that, so I was trying to follow along in the packet, but it's not at.
It's gonna be a little bit difficult because in the packet, you'll notice that I have the section households without children, then each demographic, and then the emergency shelter.
So you're
breakdown.
explaining that, can we get that?
The PowerPoint?
Yes.
Oh,
I'll
absolutely,
send it
yeah.
out.
Okay. All right,
Megan's-
thank you.
Megan's gonna PDF and send it to everybody right now, so
Oh.
you should have it
Right.
in a few minutes.
Cause I can't see what, I can't see it, so I was trying to follow.
Very fair, and honestly, I had not considered how far away these seats were, so our apologies for you not having it ahead of time. If we thought about how far away the back row seats were, we probably would have sent it out first.
Thank you for that, thank you.
Should we have a brief bathroom break or something while we? So were you guys in the back able to follow a little bit before? Because if you have specific questions, I would love to answer any, because it is gonna be the information's the same as the packet. It's just I grouped everything together for the PowerPoint.
On this one, the chart all the way on the right, the households with only children younger than 18, the N is 5. Can you expand on what group that is, that there's only 5 people in there?
That's a great question that we actually just took a deep dive into the other day. That is going to be the Alpha House.
Okay.
Yeah, so one of the safe havens, and so that's interesting enough, if you have the packet in front of you, in the appendix, I believe it's gonna be around page 100 or so. There's going to be a provider count, so every single provider reported to HMIS is gonna have a breakdown of those counts back there. So you can look, but yeah, that's Alpha House.
So that's just specific to the Alpha House participants?
Not specific, that just happens to be who has those, so it wasn't, it's all providers, but Alpha House was those who serve households only children younger than 18, so kids. And now looking at chronic homelessness, we can see that when looking at all households, so this is just every single person who is identified as shelter now. Most people who are identified as chronically homeless, they're going to be in the emergency shelter, which tracks with the definition of chronic homelessness. Households without children, we can see that's where most of the people who are identified as experienced chronic homelessness are going to be those single adults. So silver lining is, although there are proportionally not that many, it's still a relatively high number of people who are experiencing chronic homelessness, and that is a priority population. The silver lining would be significantly fewer family households are experiencing chronic homelessness. So that's the good news, most definitely. And we can see that veteran households without children, still relative to the total number of veterans, a relatively high number of people, veterans experiencing chronic homelessness. And that aligns because some veterans may have disabilities, which is part of the definition.
The top right one, that you just said significantly fewer families are experiencing chronic homelessness. Is that just from the PIT data? It's not from the Pinellas County Schools data?
Not from the schools, and this is from the housing inventory count, which
Right.
is part of that point in
Yep.
time, that was
Yep.
of the shelter count.
So, I mean, before we get excited about that.
Yeah.
We keep the Pinellas County Schools data in mind, I would. Again, it's hard to go and survey a family out there.
Do we ask about chronic homelessness in this survey data?
I don't know. And I don't, maybe,
We even have that data set.
I don't, I would assume, this is a big assumption, because I know like zeros. But I would assume the school doesn't have some survey that they give parents that says, are you homeless right now, or are you doubled up? Is it all from like counselors, teachers, people that interact with the students that way?
That's my understanding, is that these are students who come to the attention and then they are connected. Each school has a McKinney-Vento representative, somebody who's the connector. And then they work with the student and their families to try to help them connect them with services. And I imagine that's where these numbers, I don't know, I will find out, but I don't know the chain of how this data is reported or where these numbers.
So how it's, yeah, how it happens is, so as part of that, you can be identified through the teacher or counselor, et cetera. But there still is a survey that goes out to the families and parents. Typically, that's not gonna capture people who, you know, at the start of the school year were housed. But a few months later, parents lost a job, and then that's how this teachers, counselors, may get notified later on. So they don't send out this housing survey weekly. It's typically annually or the start of the semester. And this Pinellas County School Board, they actually, through that data, they have a data team and IRB process that I go through every year. And they send me the aggregate number, so not individual, but just the total numbers for each student category of homelessness. And like we talked about before, the share of housing and the cumulative nature over time is going to, compared to our numbers, the PIT numbers and the HIC numbers, it's going to be a really concerning thing to look at, as it is, but we have to be relative about it. Yeah.
And I do want to add the housing inventory count, the HIC, those numbers come from HMIS. And of course, data from DV shelters that are not entered into HMIS are also included in the housing inventory count. So this is exclusively, the housing inventory count is exclusively a count of sheltered homelessness through HMIS and our DV providers. And then there is, of course, the point in time count of unsheltered homelessness. And then the jail and the school data are a separate part of this report, and they're separated out because they don't meet that same definition of homelessness. So they're not reported to HUD alongside the PIT and HIC data. But we want to make sure that our community has a much broader and more accurate picture of homelessness. So that is why that information is included in the point in time report, because it is absolutely critical for system planning. So though this particular data doesn't include the school or the jail data, this is just that housing inventory count. That other information will absolutely be included later on in this presentation and report as well.
This is the subpopulation. So as part of, and this is actually a great segue into this slide. So when people are looking at just shelters, they're entered into the homeless management information system, HMIS. And so along their, I guess, HMIS journey, so when someone goes to a provider who enters into HMIS, they're asked a series of questions, and some of those questions pertain to disabilities. These could be adults, you know, do you have a serious mental illness? Do you have a drug or alcohol use disorder, you know, combined into substance use disorder? Do you have HIV/AIDS, or are you a survivor of domestic violence? So those are questions that are asked upon the HMIS entry or throughout. You know, someone may not actually disclose that I have an alcohol use disorder because maybe I want to get into the shelter. And if I disclose that, they won't let me in. But maybe later on they'll disclose it. So these numbers, I say all of that because these numbers are likely an underestimate, but nonetheless the absolute best you can do. So the quality is very strong on that. But still, just because of the nature of the stigma behind some of these questions, especially HIV/AIDS. Not everybody freely discloses that, especially if you want to, if you think that might prevent you. Excuse me. So green, emergency shelter, blue, transitional housing, red, safe haven. There is most people who say they have a serious mental illness are within emergency shelters, and that's going to be across the board for everything, just because there's more people. But overall. Almost 170, slightly over 160 people have report a serious mental illness. Almost 150 report a substance use disorder. And then when we get into HIV/AIDS, close to 20. And that most particularly may be an underreport.
I was just gonna suggest, would it be possible to do that by percent? That would be a more meaningful way to look at that data.
when we look at the standard, there should be a table.
Because, you know, you wanna know what percentage of people in an emergency shelter have these conditions, what percentage of people versus numbers, because otherwise it's not really helpful.
Yeah, that's a great point. So I thought of that. So that's
Like next year,
it should be in the appendix in the overall thing, or next to the figure that was so many pages. So in that section, the housing inventory, if that's not there, that's something that I can just copy over because I do have that.
That's
I think all the stats have, pretty much all the stats have the percentage in the actual report, right?
Yeah.
Yeah, I see it. Yeah, it's in there somewhere.
It's just, I think it's about 150 pages, so it may take you some time to scroll to the appendix, which is, all of these figures have corresponding tables with the numbers and percentages. It's just really far down, so it's difficult to get to. And I do include percentages in the PIT, the sheltered and unsheltered comparison, so you can actually make that direct comparison because the numbers are vastly different. But yeah, excellent point. And now we're looking at the trends. So the yellow line is total count, including all of the different shelter types: green emergency, blue transitional, red safe haven. So there's been a relatively, and you'll see, I say relatively once I show you the PIT downward trend, but relatively stable count, although decreasing. Over time, the unsheltered count has just drastically decreased. Shelter count, especially when looking at safe havens and transitional, is relatively stable. There is some fluctuation in the emergency shelter beds of the green line, and that's where you could see really steers the total count. But overall, there's been a stable but still downward trend in the total number of people counted through HMI that are experiencing shelter. Any questions about shelter? Because I'll switch now to the unsheltered count. To the point in time count survey. These graphs over here represent the hotspots of where people were actually physically counted. This one, however, represents where people report their frequent area of stay. So one of the questions, and those of you have the report open, Appendix A actually has the survey, so you can see exactly what questions are asked. And one of those questions is essentially, what area do you frequent most, or where do you frequently stay? So most people report St. Pete in the Clearwater area as their frequent area stay. That's not where they were counted. That's where the other two graphs, but that's where they report they stay. And actually, about 20, you'll notice that there's 538 people who are identified as unsheltered, but only 503. That's because some people actually reported Hillsborough County or did not disclose where they frequently stay for reasons we can discuss at the end. Similar to the past 3 years I've been doing this, pretty much the exact same trend of where people are counted along that corridor and within these zip codes. We can see the city centers, larger metropolitanized areas. So it's downtown St. Pete, more particularly, and I believe there's going to be a live interactive map that's uploaded if it hasn't been already. You can actually notice that it's going to be in some of these bus stop areas, and then following pit deployment sites. As I say every year, I pose the question to you, I always contemplate, are there any people who are experiencing homelessness in these areas, or is that just where, is there something about those areas where people, volunteers don't go to count? Maybe it's safety, maybe it's pushback from local government officials or city officials, maybe it's just the sheer volume of the size of the county relative to the number of volunteers. So this just shows where people are counted. It may not be truly reflective of actual all of unsheltered homelessness. Same format as the shelter count. We can see, breaking it down by households. This is all households, so everyone who is counted as unsheltered during the point in time counting survey. Most people identify as male, white, and over the age of 45. So that could be 45 to 54. 55 to 61 or 62 plus. But similarly, when we're looking at a breakdown by household type, that's where these disparities emerge, but actually largely to a lesser extent, and there's explanations for that, which we'll get into. But households without children, as with the shelter, mostly male. That's these are single male adults. But households with one adult child, and so family households, at least one adult and one child. That's where we see it's back to that same pattern that you're going to see. It's going to be mostly women and mostly people who identify as Black or African American. So looking at race, we see the same thing. This dark blue, looking at family households, so 46% of people who were in a family household that were unsheltered, identified as a Black or African American. And looking at other subpopulations too, the basically single, so households, wherever it says households without children, that's going to be single adults. That's going to be male, and that's going to be white. As you can see, even with veterans as well. Okay, now looking at the unsheltered age. Once again, similar pattern, which I think all of you guys know and have identified over years and on a daily basis, is it's an aging population, older population or aging population that's experiencing homelessness. When looking at households without children, once again, single adults. But when looking at family households, we can see that a larger proportion of people who are younger than 18, even you who are younger than 5 to 12, or 13 to 17, and these are the children of the people experiencing unsheltered homelessness and families. Now looking at chronic homelessness, chronic's going to be in green. This is the, I think, a point of conversation that I hope we can have. Chronic homelessness is mostly observed in the unsheltered count. You can see that almost 50% of people who were unsheltered, so about 257 people, so technically 48%, but about half of the people who are unsheltered are experiencing chronic homelessness. And that pattern holds true for households without children, which we can expect because that's most of the unsheltered, right? The silver lining, once again, for this is that families experiencing unsheltered homelessness or households with at least one adult and one child, significantly smaller proportion of chronic families experiencing chronic homelessness. And maybe more than we want, of course. We're trying to say, somewhat at the positive side compared to the single adult households, who are generally people who are more hesitant to accept or receive services and as opposed to families. So there is very good targeted outreach happening across the board because, and this is actually something I wanted to bring up about the shelter count and the disparities. Some of these disparities reflect a very targeted approach where people are clearly going out and identifying families in need, and that's why they're sheltered. It could be various populations. So the street outreach or just provider outreach, law enforcement outreach is actually doing a great job. So it could be interpreted in a negative way, saying, why are there so many women and people who identify as Black or African American? That's certainly true, but it also could be interpreted as, wow, there's really good job of targeted outreach at making sure we get those vulnerable populations, women, children, etc. Same with the shelter count. This is the subpopulation. So this is actually, these are questions that are asked during the point of time count survey. Same as the questions asked during intake or throughout someone's HMIS journey. So when they interact with providers, we can see, and this is pretty similar to years past, relative, looking at the raw numbers, about 180 people reported that they have a serious mental illness. 180 people who are unsheltered reported that they have a serious mental illness. And a similar number of people with a substance use disorder. And also, a relatively high, especially in comparison to the rest of the numbers in the overall count, have experienced domestic violence or survived domestic violence. And that could be, in some report, which I'll show you, a reason for unsheltered homelessness. Adults with who report HIV or AIDS, relative to the overall count, small number. However, this is still likely underreported, and these are people who are experiencing unsheltered homelessness and may have actually more difficult time seeking primary care or care to treat their chronic disabilities or their other chronic conditions, and also more costly to local government.
I have a question, I think it was more for the last slide, but when we're looking at the unsheltered, so people aged 25 to 64 make up 81% of the unsheltered population. 279 ages 25 to 54 and 154 or 29% ages 55 to 64. So we normally consider, right, the ages 25 to 64 as prime working ages. So do we tease out any data that though these people are unsheltered, these age groups 25 to 64, we can't assume they're all not working. Some might be working and can't afford housing, correct?
If you get it, right, so in the appendix A, if you have the actual 150-page report, you can see all the questions. So they ask about some demographic characteristics, believe employment, but
I don't remember asking.
yeah,
like,
because
are you employed
it's
or what's the last
excuse me,
time you worked
it's
or?
education.
Yeah,
So they ask about education status, and that's in there as well. So that's a great point to actually be vigilant to look at. Is one of my recommendations, not just for unsheltered, but sheltered and everything, is actually to embed workforce specialists, potentially partner with the new workforce center that opened up at the University of South Florida to actually work with vocational rehabilitation and vocational training. So,
and I don't know if Lieutenant H, like anecdotally off the top of your head, do you have like an idea of what percentage of the people who stay at Safe Harbor go out for a job every day?
I've studied it, I've looked at it in the past, it's usually like 30, mid-30s% that are working regularly.
See, that's significant.
Uh,
That's really,
yeah,
That's about the same as our shelter too.
Yeah.
that's a significant data point. And I think that needs to be communicated in these PIT reports, is that these are working poor who can't afford housing. It's not, these aren't all people who choose not to work and they're in their prime working ages.
This next slide shows by far the.
it's hard to read in the back, but yeah, I'll read this out loud. So
Well, yeah, and it's kind of like a dog question, when you ask that, it's like, well, why are you homeless? Can't afford it, but yeah.
that's one way to look at it. By far, the most reported reason for homelessness is financial problems or lost job. And interesting, for better or worse, right? You can see this lighter color, which may be hard to see back there, is last year, 2024. The darker color is 2025 of this year. So although there was 538 people counted this year compared to 721 last year, we actually still see more people, right? And this is where the percentages come in, so you can actually standardize it. But relative to that, you actually see, despite the fewer count, more people are reporting their primary reason for losing their home or becoming homeless is they lost their job or financial problems. And this is also followed by family issues, and then medical conditions, disability, alcohol or drug disorder, eviction, much higher than last year.
And natural disasters.
Exactly, right. So natural disaster, I think we all know that Pinellas County did not have the best year, and a lot of people lost their homes and a lot of other things as well. And that's reflected in this point in time count report.
And that eviction, do you know what the percentage is between 24 and 25? Because it looks like it's quite substantial.
If you look at the appendix, there's a
Okay, it's in
change.
there.
Yeah.
Thanks.
I don't have it, but
Almost looks double.
It does, I mean, which is pretty significant.
yeah. And this is, so one of the reasons,
Cost of housing.
one of the reasons that I want to get into here is, probably this is due to the loss of the COVID-19 protections, some of the housing things, and we can see that people were probably more likely to be evicted or not be able to cover rent, or if they're late on rent, more importantly, in many cases. But when we look at, this is the trend over.
Sorry, I just wanted to say, I pulled the eviction percentage. Yeah, of course. So for yes, it is 25%. For no, it is 66%. Not reported was 9% for this year. That wasn't the comparison, but that was the for this year percentages. If that is helpful.
This is the trend over time for unsheltered. So last year, I mean, I think I know I was kind of concerned because this drop, and the increase, I highlighted in red, that's the 2024 count. That was the concerning thing, and Lieutenant Hayes actually brought to the attention, because with the big drop we had this year, I was really nervous. You know, is this a problem with the data? Is this a problem with counting error? You know, how could this happen? Well, if you put it in perspective, this is the anomaly. The spike last year. Overall, there's been a steady downward trend of unsheltered homelessness, which holds true throughout the state of Florida and other counties that I've looked at throughout the west and northeast part of the United States. So there's a lot of reasons why there could be this drop.
Ms. Teresa Jones has a question online.
Go ahead, Teresa.
Actually, it's not a question. I actually was going to say that I would hope that some of that drop is related
It looks
to.
like you're talking, but we can't hear you.
Can you hear me? Can you hear me? Because my mic's not muted.
She's unmuted.
She is.
This sounds like it's more of a problem with the
We
mic.
can hear you
Can
on
you
mine
type
though,
in your
Teresa.
question?
Okay, we can hear you again.
Can you hear me now?
Yes.
I was just going to say, I would hope that the drop is related to some of the interventions. I'm looking back at this graph, and it shows like from 2017 that there has been some dropping, and I know that's when the rapid rehousing program was started. But I also am thinking that possibly that drop is because some folks may be hiding better and we're not being able to identify them in light of the fact that the new anti-camping law came into place. Thank you.
I think that's a good point. And also, the report states that we had far fewer volunteers out, like 100 fewer-ish. I think it was close to that many fewer volunteers out doing the pit count. Yeah.
I just had a thought back to Kathleen's comment on the work issue. I just don't want to lose. I don't know if we'll get it to later, just maybe it's for the point in time committee. But if this is an area where we were interested in, it might be a considerating question, because I don't believe we asked that question.
Yeah.
From my recollection, are you currently employed?
Yeah.
So we're interested in that piece, then we could really look at, okay, how much of our homeless population is working.
Is Alice at, right? Yeah, Walton.
And
But going back to the same question. The data in that question is important and trying to get to the root of this. But when I've done the point in time count in the past, and when we had a quick meeting after and afterward, I don't know if you're gonna get an honest response from somebody that you just met on the side of the road. I'm not gonna tell you that I drink an 18 pack every day and that's why I really became homeless. I'm gonna say, oh, financial items. I lost my job. So I just think it's important to keep that in consideration when if we want to heavily rely on this data.
And I was thinking too, the eviction question, and I some people may choose eviction as a choice and not financial, and they got evicted because the rent went up and they can't afford it. And so it really is both, right? So, yeah, I mean, is it eviction related to behavior or something other than financial? But oh, go ahead.
I have a question. I'm either going to open a Pandora's box and make myself look like an idiot. Have we come up with some kind of strategy on when volunteers are gathering this information, because some of the homeless are not gonna want to answer the questions correctly for fear of that information being shared with inappropriately to agencies or, in that manner, and that could corrupt the data. Have we come up with anything with that yet?
I'm gonna maybe deflect that to Victoria, but before, we talk about this, so there are, I mean, I looked at, almost every possible solution or explanation that to explain this drop. There's the positive, which exactly what Teresa said, is like in other years when other interventions have happened, there has also been a corresponding drop. So it's clearly working, something is working. And that's why, saying what specifically is working requires, I think it's maybe recommendation 3 in my report is really building that ongoing evaluation, because at one point in time where everyone across the US is guessing, but there is a clear pattern. There's also a pattern with the number of volunteers, which I put in the executive summary. So if there's more volunteers, more people get counted. And then, of course, there's also hurricanes. So a lot of people, and nobody actually has this data, which is very frustrating or anywhere, is the FEMA. So how many people were housed as a result of FEMA funds as well? And so, and also looking at, speaking with people with lived experience and everything. And that committee also just people who I personally know. There was fear of police officers. And so what the data does not capture is how many people walked away when they saw law enforcement. But in defense of law enforcement, I did a more in-depth analysis, and the number of people who completed surveys. So a lot of people, I actually looked at several of you, I think Sam and I went over it. I could see exactly how many surveys individuals completed and who completed them. About 50 were dropped from the final report because people did not disclose demographic information, i.e., or more specifically, they did not want to be identified, which we all understand. The part where it's in defense of law enforcement is if a law enforcement officer started a survey, he or she completed it at the same rate as every other type of volunteer. So other volunteers include nonprofit, street outreach, government employees. So actually, if they started it, but what it doesn't capture is how many people saw the law enforcement officer and ran away, which I probably would do.
And to add to that, yeah. To add to that, so as far as approaching volunteers, approaching folks asking questions, that is definitely part of the training process. This is entirely voluntary, so volunteers are one of my big parts of training is about the importance of consent and the fact that folks do not have to answer any questions, and they also may opt out of individual questions. And so that is something that volunteers absolutely have to face and have to deal with throughout the day. One of the things I know that we had talked about the lived experience committee getting more involved this year is helping educate the unsheltered community before the before next year's point in time count to try and dispel some of that fear. I know that that was one of the things that y'all and Kat had really, that's the secretary of the lived experience committee, had talked about wanting to participate in this year. And I think that that is going to be a really helpful thing, because we can train volunteers until we are all blue in the face. But until folks know that their data is protected, and not just in PIT surveys, in SPDATs and things like that as well, until folks know that they can trust the person with the clipboard, that is always going to be a factor. Absolutely.
I found that a lot of times certain questions will trigger the walk away, like, well, where do you stay now? Right there. That's dead giveaway trigger. So, all right, that's it.
Yeah.
Now walk away.
Yeah, and that's definitely one of the questions that we saw answered a little less frequently this year. Yeah.
Does Sherry have her hand?
Yes, Sherry.
I do. Just a quick question. I'm trying to remember this off the top of my head, but Freeman, do you remember if, and I know it's in there somewhere, was the difference in volunteers, Was that
Yeah,
this year or was last year? Was there a spike in volunteers? I can't like, how was that trend over time? I'm just curious. And then the second thing was that Cindy had her hand up a couple times. Just want to make sure that she was able to get her question
Also, to
answered.
answer that briefly, there's in the executive summary, there's a really clear image, a graphical image, but there was about 100 fewer volunteers this year. And also, a little bit more than 100 fewer surveys counted this year. So you can see it was kind of almost made a triangle. And you can see in the executive summary, if that makes sense. But yeah, about 100 fewer to answer the question compared to last year.
Cindy?
Thank you. I just wanted to remark on the chart that's actually up right now. I wanted to make everyone aware that HLA became the lead agency for HMIS in October of 2017. And so the methodology may have changed from when 211 had it in 2016, but I also wanted to remark about how it went down with COVID and now it kind of leveled out. And I've been looking for where these individuals have gone, but now we can see it's still going down. So it doesn't support, the COVID counts were not showing very high numbers. We did do like an average for 2021, but it wasn't used as part of an upload to HUD. But I just wanted to remark that the high end there, I'm not sure if they use the same methodology as we did in 2018 or not. So that's why you see that large dip. And then COVID, of course. That's all I wanted to remark on.
I'm gonna, well, how do we do?
Yeah.
That's okay, if it's a little over, I could speak through things more. I know there's an agenda that has to be done after.
Yeah, we can go a little bit over, but I think, there's probably gonna be some robust discussion of your recommendations too.
Well, maybe should we just jump into that, because this is the comparison. I'll just do, let's do the 4 minutes or less for the rest of this. Comparison, this is standardized. So in this one, there is clearly more people who are sheltered who experience homelessness at the top left, as opposed to unsheltered. 29% of the total people experiencing homelessness, according to HUD guidelines, were unsheltered. When we look at the racial distribution, same pattern holds. It's really going to be, we're looking at all households going to be male, and that holds true between sheltered and unsheltered. And it's going to be, when we look at all households, it's going to be people identified as white. When we get to households without children, it's going to also look a lot like all households. But when we get to households with at least one adult and one child, the family household, we can see that there is that disparity between families, gender, and race when looking at those household types, which we talked about already throughout. The jail information. So on the night or day of the count, there was almost 3,000 people who were in the jail. Of those, 125 did not disclose a permanent address, or there's other characteristics as well that they were going to state prison if they disclosed, or if they're in there longer than 90 days, etc. But we can see that 125 people, about 4% of the jail population on that day, did not disclose a permanent address. Most of those are male, and as opposed to the PIC and PIT counts, shelter, unsheltered, most are 35 to 44, which lines up with demographic characteristics of people who are arrested is typically around that age range. We start to see the aging population for people sentenced to prison, which is different than jail. And most people identify as white. And these are the characteristics that racial demographics are provided by the jail. When we look at the geographic distribution, this is where people are arrested. So not necessarily where they reside or frequent area stay or anything, but this is of those people who did not disclose a permanent address. This is where they were arrested and brought into jail. So one of the recommendations probably a very difficult one would be to actually work with the jail, the Pinellas County Sheriff's Office, local municipalities to figure out a way to track homelessness related offenses leading to incarceration or arrest, especially in light of the anti-camping legislation. Maybe create some kind of code that may be on the front end where arresting officers, but I put it in there. I put it in there.
There are lots of good ideas in there.
We discussed this at the Public Safety Coordinating Council a little bit extensively. Kind of looking at the jail indicator report, looking at that, we saw more stuff on nice stuff. Yeah, there's not really any clear indicators because the way the anti-camping law is written, it's not associated to a specific violation of state statute. Right. So encoding those, they're being, the individuals that are being arrested on existing ordinances and misdemeanor violations that are possible. So trying to track people that are arrested in relation to House Bill 1365 becomes basically impossible. And we really tried to dig deep into this too, because when you look at the jail indicator report, it really breaks down, and we've been working from that end on trying to, get the jail count down. And really the jail count is steady. And I think I texted Amy in April about this when we were having this discussion, because where you saw the difference really, so there's a lot of pressure on you guys on federal stuff. That's really what, because otherwise it's actually the jail count's gone down. It has. Yeah. If you take away federal holds, whatever holds you want to look at, the jail count's actually down. So it's.
And what time frame?
We were comparing it year on year, and then we also then broke it down for each of for the first 6 months of the year.
This year.
Of this year, because I was curious about that as well. And I know that this is not your discussion, but bringing it up, the jail count year on year, month to month is down, except for the increase in federal holds. It's pretty much everywhere.
Is that total population or people who did not disclose an address?
No, that's everybody. Everyone. Yeah, that's it.
Well, that's good information. Actually, that might be something to consider in future reports or hopefully future evaluations.
Yeah, because when you get, since Kathleen berated us to make sure we were ready for the meeting. I saw, when we get to the recommendations, that was something I was going to bring up is, there are ways that we could coordinate between, with the Public Safety Coordinating Council, we do the monthly and we meet quarterly, but we have those monthly indicator reports. The Sheriff's Office is already collecting that. I mean, when we did that sequential intercepting mapping a couple of years ago, we basically came up with the plan on how to engage prior to and eliminate and do discharge planning ahead of, at the onset of incarceration for this population. It's kind of mapped out. It's just trying to find a funding source for it. Right.
I'm glad you brought that up. So sequential intercept mapping, I left out, that's actually what I got my PhD in strategic planning, but that would be, they offer those for homelessness to map the homeless system of care. So that's something that's kind of anecdotally discussed in the recommendations, but that's really overall a map is needed to paint that picture. HMIS has a really good flow through chart, but let me do I think I passed the 4-minute speech. So we can see the jail trends have gone down. Compared to last year, they've also gone down. You can see this big spike. That was the change in methodology. So I think future reports we might want to consider starting from last year. So you can start seeing, because this really it skews an understanding, because this is a change in methodology, but we can see that there has been a decrease with the same methodology as opposed to last year, which is great news.
You have a question?
I have a question.
Oh, sorry.
And then with this. So when the jail is making their count, is that just the address, non-address given out?
Are you for the homeless related count?
Yeah.
Yeah. So what we do is we take everybody that was in jail that night.
Yeah.
And then we subtract the people that were in there longer than 90 days. And then we subtract the people that were transferred to a different prison or a different institution. And then we subtract, and then we remove the people, yeah, it's that category there, and then we remove the people that disclosed an address upon release. So those individuals probably didn't want to give her their address when they got booked in. And then, so after all, eliminating all those factors, that's when we're left with 125 people that likely walked out the door, that were in custody on that day, that were probably returning to homelessness or going into homelessness.
I just wanted to, because, 20 years I've been handling, very handling advisory, get guys that either the address is Daystar.
Yeah.
Or it's Pinellas Hope or something like that, and.
So those addresses.
That's not, that getting captured by somebody like picking it up.
Yeah, you're looking at it. Yeah, I'm the data point on all this.
Yeah.
So when I do that count, I make sure that addresses that are St. Denis, Turning Point, Safe Harbor, all those are included in that 125.
So the school, we shouldn't breeze through this, but we can see relative to the overall population, keeping in mind all of the discussion we had of homelessness and everything, about 4% of the students within the Pinellas County School Board were identified as homeless. The vast majority, which we got ahead of ourselves a little bit in the right direction, I will say, is shared housing, which is blue. So people who were considered unsheltered, so these are the categories provided, outlined by the Pinellas County School Board. So unsheltered, emergency or transitional, hotel, motel, so, that's not captured, into HUD stuff, or, shared housing, right? Very few people relative to the total population, were experiencing or reported unsheltered homelessness. Once again, during a 4-month time period. So not just one point in time. So if this was if we did a point in time count for school on one particular night, I would wager that number would be significantly smaller. Still very problematic, but we have to keep in mind the methodology of the school. So relative to all of the population, about 4% of students, and of those, most of those are shared housing.
And if you report you're unsheltered, you risk losing your children.
This one, yeah. So the demographics, the characteristics still hold, really quickly. The only difference being it's a very even, almost exactly similar male, female difference, and so our boy or girl difference, for student homelessness. We can see that when looking at the racial distribution, we still see, unfortunately, that 41% are, most of the people identify as Black or African American. And they, just like the overall population of Pinellas County, people who are identified as Black or African American make up, I believe it's about 11% of the total population. But in this case, and student homelessness and other types of homelessness identified for HUD, make up the majority of people who are counted. And most of the students here, between the age of 6 and 12. This is just showing the different demographic breakdowns by the shelter type. Most people are shared housing, and it holds steady kind of throughout. And then the change over time, it's been relatively stable. Could be interpreted as good or bad, because I know the schools do have a lot of resource officers and resources there. But what seems to be the interesting thing, in my opinion, is when looking at the housing trends of students younger than 18, more stable. The housing trends of people who are 18 or older dropped, and that's looking at the shared housing. So that's something that we don't dig in. I don't dig into in this report, but I think should be later on. Okay.
Just a quick question on your comment. Is this survey anonymous? The school survey, you said.
Well, yes, so when I'm assuming like when kids register in July, August, get the big packet of filling out everything. Is there a question in there that says, and so then that would not be anonymous? That's part of a registration packet. Where are you currently living? Are you? So, yeah.
Do you have to put your name, you have to put identifying information on the survey.
Your address.
As a parent, I know throughout the school year, I've had to answer different questions. Now, both my kids attend Title I schools, so I'm always filling out Title I surveys. That often will ask those more specific questions. I'm not aware of how this data is collected at what point, by what means. I'm happy to get all of those answers and bring them back to the board. I do want to highlight that on page 140, if you go almost to the very last page, the very last page, is I found to be a good data summary chart. You all want to look at that. And at the bottom of that chart, page 140, it has all images. And it shares the total homelessness from years 2016 to 2025. And it's, I mean, interesting to see, fortunately, how relatively stable that number, that 3,000, 3,500 number has been. But then you have to look at the percent. And I just wanted to share, if you want to look at that number, because when we first saw that first slide, and you see that 3,600 number, then to look at it over time, and then further to understand how are we gathering this data, who is it coming from? And I do know for a fact that every student is connected with, if they can't get to their school, and then connected with services, so we follow up with our heat. So definitely try to make sure they're connected with the right schools.
All right, do you guys want to talk about the recommendations? I think for time, maybe we just, I think you all have glanced over them. Do you guys just want to talk openly about some of the recommendations and what's feasible, or would you like me to go through the slides? Either works. I know we're just on a time constraint.
I think a general conversation would be good, especially because I had asked people to take a look at these. I want to just mention myself, Anne Marie Winter, Teresa Jones, Sandra Newsom, and Lieutenant Hayes were part of the Pitt Count report work group. So we, I don't know, it was like maybe an hour and a half or 2 hours, gave feedback on what we'd like to see in the Pitt report. And one of them was under the recommendations, because in prior reports, it was just like a half page of 6 or 8 recommendations. And so we had advised or requested some short-term goals, like what could we work on for, in a year, and what would be some longer-term goals. So I very much appreciate you doing this. The first thing that hit me, there were a couple things that I would just throw out there is, these are wonderful recommendations. And in a perfect world, we could do a great job with all of them. My thing was, where's the capacity and where's the funding? And then the other question I had was, I think we need to talk about capacity and funding. I wish we had more elected people here. We've got to go out and get our providers to fund these things. And they are working. We are seeing, if we're looking at a decrease, things are working, and we need to continue that. So funding, capacity, prioritize. And then the last thing I would say to you is, do you have a corresponding CoC or agency that's doing this thing well right now that we can model, rather than reinvent the wheel and start from ground zero? Who is doing X, Y, or Z well that we can reach out to learn from? And so that would be my initial feedback about the recommendations. And then, as I look at our whole board, who's willing to step up and take one of those bullets and say, I can lead this, or I'm already doing this, I'll build on this. So that's a really important conversation that absolutely needs to be more than 10 minutes. And so I would propose we have a special CoC board of directors meeting to talk about the recommendations, like over 2 hours.
Yeah.
They deserve at least that.
I think that's a great idea. And what I want to disclose, before this, because I think actually most people are doing many of these recommendations already. I wanted to make sure to put those into, because for the simple reason of why reinvent the wheel, it's working. So I put those, many people are providing trauma-informed care. Many people are advocating for legals. Many people are doing X, Y, and Z. So many of these recommendations are things already being done. So I want to, and this may be a point of clarity, especially, for example, in reference to data analysis and evaluation. HMIS has a very robust infrastructure, and the HMIS team at HLA, who are, the level of detail that they go into, and then I get the opportunity to go into with them is amazing. And So there's already a lot of work in the data analytics side, so you may see recommendations about, do audits and things like that. HMIS does that. There's also, capacity issues, so that's just an example, right? But I think many of the providers in this room and online are gonna look at these or have looked at these and may either be frustrated because you're already, you guys are already doing it. Or, what I hope to do in this report was to actually give recognition to say that, man, you guys are doing it. And so exactly what you said is to build upon it. So maybe we have a conversation about that, but it does deserve its own
It,
meeting.
it deserves a robust, like almost a full day workshop or something,
I
you know?
actually just brought that up yesterday, yeah.
Does Teresa have her, I mean, I'm just,
Yes, Teresa does have her hand up.
Teresa?
Thank you, Madam Chair. I was just going to concur with your recommendation that we possibly schedule a separate board meeting or to specifically deal with these recommendations. I also concur with what I believe I heard Freeman mention, is that some of these recommendations are already in place and happening. I won't go into specifics, but I do think it's worthy of a broader discussion than the remainder time of this meeting. Thank you.
Ashley?
Can we survey providers council to figure out how many of these are already being implemented, and so that we can kind of prioritize the recommendations and then have that work group to discuss?
I think that's great there. Evan, good?
Yeah.
Michael?
So I want to say a couple of things. First of all, I wrote in a lot of the notes that I wrote here is similar to what you started with, Kathleen, and I don't know if we want to get into a bigger discussion here because, if we were to schedule another meeting, I think we can almost have a discussion about almost each one of these recommendations separately.
Yes.
And the thing is that every one of them comes back to how are we going to fund it?
Yeah.
And even in the comment you just made, we need to get our providers to fund these things. We need to get people who have money to fund the
Yes.
providers to provide these things.
Yes.
I think that's a clearer way of saying it, because I think from a provider standpoint, we go after funding however we can to provide services. And one of the good things that we have done is by having those joint meetings of the Funders Council and Providers Council, at least we're coordinating better, and making sure that from a provider standpoint that the funders understand just the one example that jumps to mind is when you have different interpretations of CDBG and we have to, if we get more consistent policy, it'll be easier for us. But in looking at some of these things like enhance HMIS data quality, and it said something along the line of increased funding to expand HMIS staff capacity. Let's increase HMIS funding to allow agency capacity so that we can do a better job of entering into HMIS. I mean, I look at Ashley's program and how large it is. Even our program, we've got more than 100 people in housing, and it's a lot of work. And so all right, then if we fund more positions at the HLA, then are they going to come do this for us? Because there's always this expectation that we have to figure out how to do it. I guess my point would be, is when you look at each one of these, they can be pretty separate discussions.
Yes.
Because the last one that I wanted to bring up is, when you talk about on a recommendation to encourage affordable housing development through local incentives, fee waivers, expedited permitting, flexible zoning and density bonuses. I agree with all that. And there's not literally one person who's on this board or in this room who will talk about, expedited permitting. And
Well,
even
elected officials.
okay, but elected officials aren't staff. And when
Right,
you try to
right.
do a project like this, I love Deborah. She is one of the best people I've worked with in government, period. And I'm glad to say that publicly. You know what? She can only go so far as an elected official. When you were an elected official, you met with Mariana and I.
Yeah.
By the time it gets to staff, that's a whole different discussion and a whole different set of things. And yeah, eventually it'll come for a vote. But, we need affordable housing now, not 2 years from now, when staff is done kind of tearing it apart and telling us why we can't do things. I had a discussion literally yesterday with some planning people at the county, because we want to put a contract in on a piece of land where we could do a pretty substantive affordable housing project. And, and the first discussion is, well, you've got to meet with these people because the neighborhood's going to push back. And then by the time it could still get approved, by the county commission because of the nature of the project, but this particular neighborhood association always fights everything like this because you want to do multifamily and they want single family and staff, it slows the whole process down. So that sounds great,
I know, yeah,
but like no one who can really do something with that is part of these meetings.
But I think we have to start somewhere.
we do.
We have to start somewhere. I really appreciate, the recommendations and the targeted way you put short-term and long-term goals. I think that is something that we wanted from last year's report, so that's great that we have that. So I think we're building on it. And so I think Ashley's point about what is being done, let's recognize that and then have a meeting to decide, okay, well, which of these recommendations are we really gonna focus on? Get data to support what is needed and then make the pitch as a board to, whether it's the county or the municipalities or other funders, because that's what they're looking for. They're gonna want substantive information on what the ask is and what the justification is. And I think we have the data now that shows what we need to do with recommendations, and it's just putting that together. So I do think that another meeting is needed. But I agree with you, Michael, that, we do need influential, those that can influence policy and funding to be here. But I think we are on the right track to start doing that.
But I hope we do this because, one of the things I wanted to do and didn't have time to do is go back to last year's recommendations, because we had the data last year, we had the data the year before, we had the data the year before that. Every year we have sets of recommendations. Do we act on the recommendations other than we have them?
Right.
Because if we don't act on them,
Right.
then we're just gonna have the same discussion every
Right.
year.
Well, I would propose, since it's 10:40, and I feel that the report is the report. I hope that I appreciate all the work that Victoria and the Pitt group did. I appreciate Dr. Gephardt and his report that he's done. I hope that we can approve the report, the official report today, and vote on that. And I would propose that we can either hold a special board of directors meeting just to talk about the recommendations and get some overall, people can vent and have their feedback and have a 2-hour meeting that way. But I think it really deserves a work group that will continue to look at these recommendations and, let's assume we have a 2-hour full board meeting, anybody can attend and give their feedback on these recommendations, prioritization. Take into account the providers who have already given us some focused information. But I think it needs a work group to continue forward throughout the year, really.
So, I would
So
almost.
can I interject for a
Yeah.
second, please, because I did have my hand up.
Oh, I'm sorry.
So we're going somewhere else, and we'll be talking about this for a minute. So thank you so much for that, Chalazo. I think where we've gotten to is that we need another work group. I think we've already landed on that. I think we've landed on the fact that we have the recommendations that we appreciate, and thank you so much for your presentation on that. We've landed on that. Also, as far as the funding is concerned, and thank you, Mike, again, for making that point that you can have electeds here. I just had some things passed in council yesterday that I started back in 21. So there's nothing that moves rapidly, when it comes down to things like this. So to Kathleen's point, we have an advocacy committee here now that's already active. My question would be for the board, and I did hear what she said in regards to starting a different work group. I don't want to keep starting a whole bunch of different work groups for me, because I don't want to overtax anybody. Would it be beneficial for us to take the providers council, the funders council, and the advocacy committee to review what we've already done to go over the recommendations? Because I agree with you. We do need to have a separate meeting, because I'm also looking at the time, as you stated, it's 10:46 now. Because we'll be talking about this for like another 30, 45 minutes. Is there some way we can go ahead and schedule a meeting now, combine those committees and to dissect what we have as far as the recommendations are concerned? Because you're right, we can have every elected official, including mayors, they still have to go through somebody to get it done. So everybody has a role in this, and I'm just hoping that before we leave today, that we can have that conversation as to what the next steps look like before we leave, because I don't want to take your agenda, Kathleen, but I know we do have quite a bit to do. So I just kind of wanted to put that out on, because I kept raising my hand trying to.
I appreciate that, and I'm sorry I didn't see you
Oh,
sit shoulder to shoulder. I appreciate the funders, providers, and advocacy could do that, but like any committee and work group that we have out there, it's open to anyone.
We know, open to everybody, but we gotta get somebody to try this.
And then as far as scheduling or setting a date today, we need to do doodle polls and that kind of thing, but I think that's a valid suggestion.
So
Michael,
two, and I will be.
and then I saw you, Megan, yeah.
Two quick things. One, I think that, and I'll be glad to make a motion to accept the reports, because we want to get that done
Yeah,
today. I think you're right about that. But I almost want, at least for us to think, we have another meeting, really, and I'm not saying we need to have 7 subgroups.
Right.
That's where I was trying to go with this, is that you have 7 recommendations that are not all the same, and some of them are very distinct. And I would rather have 7 subgroups, one that brings all the officials from Clearwater, St. Petersburg, Pinellas County for unincorporated, to get staff here when we're gonna talk about permitting. And if we're gonna talk about evaluation, that we get the right people here, because us meeting as a board on a 5,000-foot level with these things.
Yeah.
Isn't gonna really get us where we wanna go.
Right.
That's all I was gonna
Right.
say, but I
And
will
we
be
do
glad to
need-
make the motion on such a report.
Second.
Okay, so we have a motion and a second to accept our 2025 point in time report. All those in favor?
Aye.
Online, could you please vote with a button? Megan, let us know how that's going.
And Sandra's hand.
Sandra, does have a question.
Okay. Sandra has a question?
Yes.
Okay, go ahead, Sandra.
Hi, thank you. Actually, I'll hold back my question. I guess some of these recommendations, and I think having a work group is really important, given some of the changes in the federal level on funding might impact how some of these recommendations move forward. So hopefully we'll have more clarity about that when that committee meets, but just something we need to keep in mind. But I will participate in the discussions at the time.
Thank you. We value that. That's an excellent point. Yeah, thank you, Sandra. Go ahead, yeah.
Based on what she just said with the funding, what is the recommend, because I don't know what the timeline looks like. How soon should we be acting on this as far as getting together to talk about the recommendation?
I think-
October.
Before October.
Well, and I think ideally as soon as possible, and when we're presenting to municipalities and governments who are planning their budgets, right after the start of the new budget year, they start to plan for January discussions. We need to be ahead of that, ideally. Yeah. So, no, we're looking to keep going. Okay, so we have a motion, motion approved, and it's approved, right? Oh, Victoria?
Sorry, I wanted to have, there was, Sherry, do you mind if I ask you to come off mute real quick? And I just wanted to ask Sherry if you, before the report's final approval, wanted to discuss recommendation number 3 really quickly, or if you are.
There's some, so maybe
I think-
just really quick, so there's actually one table I need to add in, which is actually the jail count of ages. So there's 3 copy edit issues. Doesn't affect any of the data, any of the results, but I personally want to add in some of the additional tables for clarification. So I do edit in with those three, adding in a table and then changing a few formatting things. Like in the recommendations, you may notice some spacing issues and things like that. But yeah, I think is that what you were getting at, Victoria?
Yeah, I wanted to make sure that the board was aware of that, just so you don't, no surprises.
Okay. So, Michael, do you wanna modify your motion to approve with the minor edits that, Dr. Gerhard
I'll
suggests?
make that friendly amendment. Okay. To approve the report with edits to be made by Dr. Guerra.
Thank you. And second?
Yep.
Okay, thank you, Sam, all right.
And they're already done actually, so it's just a matter of resending the package,
Okay.
so.
Can y'all repeat that motion? I couldn't hear what he said, what the motion is now.
It's the same motion, Teresa, just with acknowledging that there will be edits to things added to the report by Dr. Guerra.
Formatting.
Thank you.
So. We need to revote on that, with that amendment.
With friendly
Okay,
amendment.
yep. All right, so, all those in favor of, Michael Gelazzo's motion with the friendly edits, say aye, or and vote online. And then any opposed? Okay, thank you very much. Thank you for approving that, very important report. There'll be a press release that goes out. And I would hope that, first of all, I appreciate the one pager that's included. And if you have peers or, other elected officials or people that you want to share that with and discuss it, it's a good starting point. And, the executive summary at the discussion, I guess it's called a discussion, at the end is easy to understand and highlights higher level numbers. And I think we need to talk about the successes that we have had, the reduction. We talked briefly about what might have impacted those lower numbers, but we also could think about things are working and we need to continue to fund transitional housing, permanent supportive housing, rapid rehousing, landlord liaisons, all those things that are working. And we need to be aware that we didn't discuss either that the growing demographic of elderly entering homelessness is something that needs to be addressed. So, great, thank you. And then we will, the executive committee meets right after this and we'll kind of formalize some ideas about that, what a work group will look like or a special CoC board meeting to discuss more fully these recommendations because they deserve full and robust discussions. So thank you. All right. We have worked diligently on, we as in the executive committee and the HLA board, as well as Sherry, our HLA interim CEO, and our pro bono, very appreciative legal counsel of Greg Payton and Murray Silverstein on revising and tightening up the MOU. We did not start from ground zero. You have a red line version. And let me tell you, this went through dozens of hours of work and conversation and feedback. I greatly appreciate Kevin Marone, April Lott, Councilmember Big Sanders, Michael Crichton, and all who are involved, Kimberly Rogers and Pamela Qualls. So if there, it's open to discussion. If anyone has any questions on this, Attorney Gregory Payton is here, as well as, all of us who are involved in it. But this clarifies duties, and it just comes on the heels of some frustrations with some of the HLA leadership last year, and in particular, transition around the holidays that was frustrating about expectations and responsibilities. And so now they're just tightened up and fully agreed.
And may I add,
Yeah, go ahead, Sharon.
Kathleen, I only was able to participate towards the tail end of the process, but I think that a lot was done during that time. And so that, in bringing in Greg and Silverstein Murray, awesome job and very helpful too. But when I look at this MOU, it is a coming in as staff initially almost a year ago exactly, and reading through it for newer folks coming in, being clear on those roles and responsibilities and clarifying that here, I think is helpful for all of us as staff members of the HLA. But when I look at this document, it really is, it's like a marriage, a relationship agreement here. It's what the HLA is responsible for, as well as what the CoC board is responsible for. It's a joint, given reciprocal agreement on what our roles and responsibilities are. And so I think that it's not. I like viewing it that way. We don't exist without you, and we need to work together, of course. And it's not a transactional contract. It's not a I'm purchasing, I'm paying for somebody to mow my yard. They mow it, it's done. I don't really have to do anything beyond. It's a mutual relationship that we're engaged in. And so I really am proud of how this document has shaped up. And I do think it clarified quite a few things that were frustrating staff as well, just making sure that we were on top of what we need to be doing. So I appreciate that. Thank you.
And we also had feedback, especially from our executive board member, Michael Crichton, who serves on the Lived Experience Advisory Committee as co-chair there, about one of our first whereas is that the goal is to reduce and prevent homelessness, and that's, front and center and all the work. So do we have questions online at all, Megan?
You have a hand up, Ms. Teresa Jones.
Okay, Teresa, go ahead.
Madam Chair, I move approval of the item to the MOU revisions and the final document.
Thank you.
Second.
Thank you, Emery. All right, so we have a motion in a second. All those, any discussion? Okay, all those in favor? Aye. And those, please vote online. Any opposed? Okay, thank you. Thank you very much. That is a significant accomplishment. It really, really is. So thank you very, very much for all those who worked, and yes, go ahead, Deborah.
And I can't sit here without thanking Kathleen for this process. She was phenomenal throughout this entire process. For those of us that were in it from the beginning to the end, I have to thank you for your, no, serious. You did a fantastic job of keeping us together, keeping folks like me kind of corralled in when we veered off in trying to get something done. But more importantly, the bridge that you helped build with CoC and HLA during that time. It was a stressful time, and you handled it well. So I just have to publicly say thank you. Thank you, because I'm one of those either or kind of people. You were able to keep it, going in a positive. Yeah, it was a great experience knowing that you were at the helm of that ship. So I gotta say thank you.
Y'all worked, y'all have your expertise, and it was invaluable. Thank you. Thank you very much. Thank you. It was good, important work. The next thing we have on the agenda is the conflict of interest statement. And this is very important. And again, many thanks to Murray Silverstein and Greg Payton for working with us on this. This is not part of the agenda. It is being finalized, and we're like 99.9% there, and it will be at a future board meeting. But it's important to have a conflict of interest. This is coming. I mean, we do have a conflict of interest statement. and policy. But we're refining it, and we're going to make a verbal statement at the beginning of each CoC board of directors meeting that you are expected to read through that agenda that's sent out a week ahead of time and look at all the agenda items that are for action and ask yourself, do I have any potential conflicts of interest in voting on this item? And so I will be asking you at the next board meeting at the beginning, you know, we do our introductions, appreciations. I'll say, does anyone here today attending our meeting have any potential conflicts of interest on agenda items coming up? And then we have a whole procedure for addressing those. And so we will be doing that. So it's just part of the expectation, and it's good practice. So that will be coming, and we'll probably email it out to you to take a look at it prior to the meetings. Obviously, it'll be attached to the next agenda, but I just wanted you to know that that's coming as well. Any questions on that? Okay. We have for agenda item 5, council and committee requests. We have the status of the Systems Disparities and Inequities Task Force. The executive committee is recommending to permanently combine this SDI task force within the Data Systems and Performance Committee. And so I'd like a vote to approve that. You know, Sam can speak to this a little bit if you feel comfortable, but you know, data systems and performance, we do all of our work based on data. It's not just anecdotal. And so that's why we have HMIS. That's why we have the PIT report and count. And so our decisions and actions and priorities are based on data. And so we address inequities and systems disparities should be addressed in that committee. It's not that it's not going to be addressed, it's that it will, our proposal is that it be housed in that. I'm gonna let Sam, did you have anything to say? Or do you have any questions?
No.
Okay, okay, yes.
It's Teresa Jones.
Okay, Teresa, go ahead.
Thank you, Madam Chair. I was just going to say that, you know, I'm not necessarily opposed to this recommendation from the executive committee, but I want to bring some historical perspective. You know, this committee actually was specifically related to diversity, equity, and inclusion. It came out of a previous disparity study that was conducted that clearly showed, and now our PIC confirms, that African Americans are substantial, are disproportionately include in our homeless population based on, and I say disparity because of their number, the percentage of African Americans in our population is much lower than what it is represented in our homeless population. So, you know, I know we changed the name because of the current political atmosphere in this country and in this state. And so added it to the existing committee that looks at the data, I think the mission overall will be watered down. And I don't know how the information from the current committee will be then translated and passed on to the advocacy committee. I'm not certain how the overall initial mission of trying to address disparity of individuals that are people of color and marginalized citizens will be addressed by combining it into this committee. Also, the only other thing I would say is that I would suggest polling the members of the committee to see if, once we take this action, I anticipate that it will in fact pass, whether they still want to be involved with the committee. Because we had individuals like Dr. Susie Patterson, who is not otherwise engaged with the CoC, that was leading that committee. And whether she'll want to still be involved or whether I will even want to still be involved is questionable. So I just wanted to put that out there, that let's not forget the mission of why we started that DEI committee and how we will try and still address the issues of the disparity that exists in our, and I saw recommendations that came out of the Pitt report that sort of address that. But I just want to keep that in the forefront of the discussion. Thank you, Madam Chair.
Thank you. So Kevin.
I guess along the lines of Teresa's, our simple question that is the title of the committee going to change? Should we change the title to maybe be more intentional, in that word, so that we not lose some of that others. Data assisted performance. I mean, it might imply it, but is it? We need to be a little more intentional about it.
Yeah, alternatively, could there be a seat on the committee who is responsible for making sure that those topics are included?
Yeah, and I would say, first of all, it's my hope and intention, Teresa, that nothing gets watered down that way. And I would say, you know, to ensure that things don't get watered down, we need people like you and Dr. Susie Patterson to be part of DSP. And that's, you know, that would ensure that things don't get watered down and that recommendations are made to the advocacy committee or the executive committee or the board as a whole. But we need your voices there. You need to be a seat at the table. I don't know. Go ahead, Beth.
And can I add to Ms. T, if everything that we did was based on what it was called, we would never get anything done. So I just want to state that I hope that you will remain on the committee, and as boisterous as I am about DEI issues and concerns, I don't care what you call it. It's the work and the mission that we put into it. And I think I get that satisfaction from coming from and working on behalf of the city, also with the mayor that refused to take away the word equity, that refused to take away the word diversity. So it doesn't matter what we call it. It's the motion that we put into action that really matters. And I don't think we're gonna allow it to be watered down. And that should be our responsibility. So I'm hoping that would kind of appease your concern with it being diluted some, because we have a lot ahead of us right now. With what we are dealing with, we have to come together now more than ever, because as you know, the city of St. Petersburg, and that's $6 million deficit. So a lot of the social action services and those organizations, we're gonna have to find a way to creatively work together, and I don't want us to lose any of that based on what we're calling it. Does that make sense? So I'm hoping I addressed your concern, as far as we're concerned here on the CoC.
Sandra, go ahead, Sandra.
Yeah, I actually just want a clarification. Why embed it into the Data and System Performance Committee? What was the rationale for that again? You might have said it and I missed it.
I think because the inequities are evident in our data. I mean, they're glaringly evident in our data, and that's what we're operating off of, is what our data shows. Our data shows that there are disparities and inequities, and so now we need to take action based on that. Go ahead, Sam.
So just to follow up with that though, if I may for a moment, I agree that the data shows that inequity very profoundly, but I'm also wondering, shouldn't it should be embedded in every group anyways, because the whole process of really focusing in an intentional way on equity and inclusionary practices across everything the CoC should do. And I also think very strongly, and I'm very aware of the climate we're in and how we all have to be very sensitive to that. But we also have people paying attention. And it's important that they see us stepping up for the to be aware that these are issues that maybe the provider forum or the provider group also has a piece of this and embedded into their overall scope of work. I don't know that data is the only place it should be, and perhaps it should be kind of in a, I just think it's really important, and data seems to get so big that it's one of many things, and I don't know that it would be the best place. I'm not quite sure where it should go, but I feel like it warrants us to kind of think about more. That's just my thought.
Okay, thank you. I think Sam, did you have a hand up?
I'll withdraw. I don't have anything to add.
Sure. So, Councilmember Fig Sanders is suggesting we look at this in our following executive committee based on feedback. So we can do that.
Ms. T, do you have any recommendations that you would feel comfortable with that would span across the board in regards to us not losing focus of what the committee was? Because I was there when we established the DEI committee. So do you have any recommendation? Is she talking?
Madam Chair, I would move
Yes.
approval of the recommendation. And hopefully the discussion will drive how the immersion or embedding of the committee into the existing data systems and performance committee will function moving forward. So I'd move approval.
Okay, thank you. So I have a motion to approve it. Do I have a second?
I'll second.
Okay, so I have a motion in a second. Any further discussion? All right, all those in favor? Say aye. Aye. And please vote online.
Can someone clarify what I'm voting for this time? I'm sorry. Is it the same recommendation to embed it into?
Right.
And given what I believe the Councilwoman just said, is that also going to be discussed further in the executive committee?
I think, well, I mean, I'm not gonna speak for you.
Well, no, just based on what Ms. Jones just said, she and please correct me if I'm wrong, she motioned to accept it with the assumption that we will discuss it to make sure we don't lose that focus. Did I hear that correctly?
She doesn't want it watered down.
She doesn't want it watered down, so that, I guess that would cause us to have additional conversation. If I'm Sam.
Yeah, and I think we talked, Susie and Sherry and I talked about this prior to the meeting as well. I think the logic is that we would talk about it at executive committee, and I think the logic is also that there would be some restructuring of how data and system performance works. We just approved our charter, but I think we would relook at that in the light of this, and maybe more to the point, in the light of strategic planning for the whole continuum of care, because we have to, I think we're due for some rethinking about how a lot of our structure works. And a big part of that is about equity, and that's got to be embedded in the whole conversation. So absolutely, this is one move to embed diversity and equity and inclusion into data and system performance where it has always been, and to make sure that that's a strong focus for the whole COC.
And as we go forward with our strategic plan and gaps analysis that's informed by data, it'll certainly show up in all those documents as well, as it should. Does that clarify things, Sandra?
Yes, thank you.
Okay, and then Lisa? Is your hand up?
Madam Chair, I was just going to suggest we've already taken a vote that we move the agenda.
Okay. Okay, all right. All right, so funding and legislative updates. Sherry, do you want to start us off here? Please.
Sure. So we were for the FY 2025, 2026 state budget that was finally passed and approved and signed into law by the governor on June 30th. And so we were able to, have our contract then executed on that same day, and received what we anticipated receiving for the year. And I'll be talking about that a little bit more later on in the agenda. So that happened, but reflections. So Kathleen and anyone else involved, I don't remember. I don't believe Kevin was able to be there, but we did have a joint funders and providers meeting where we decided to intentionally spend a good chunk of time and made available to other board members as well as lobbyists or policy governance affairs officials across all the municipalities were invited as well. And we had a very good discussion about some of the concerns that are occurring politically and with funding statewide and federally. And some talked about contingency plans. And so some at least discussions started around that. And so I don't know if you have anything that you wanted to add around anyone from Funders Council or providers wants to add on that.
Yes. Oh, hi, good, Bill.
I was just texting her, it's a big transition, should I bring this up or not? So, so HUD funding was not part of the bill that was passed at the federal level. They're expecting discussions to start this next week on the transportation, housing and urban development bill. That's the one that would encompass most of the federal funding that we see for different housing and homeless programs at that federal level. Only the president's version has come out so far, which basically was removing numerous housing programs and replacing it with a state block grant for rental assistance, but at about 40% of the funding level of those other programs.
Mm-hmm.
So that's one thing. The other thing, there's a national organization that kind of keeps us, all of us grantees, informed on what's going on, what policies are coming out, lets us talk as well. So all of our action plans, first like CDBG and home funding, and ESG, those are our funding applications to HUD every year. We've been informed they will be run through AI and they will be checked for DEI terms and they will be rejected. We have also been informed that certain jurisdictions throughout the county or throughout the country received their comments they submitted on one day to HUD for their plan. Comments came at 5:45 p.m. the next day, and all revisions had to be done by 5 p.m. the next day.
Oh my God.
And if
That's
you
the
haven't
right
let your
reaction.
HUD rep know, right, if you have not let your HUD rep know to email multiple people if that person's out on vacation, you're out. Like one jurisdiction had a battle, they were on a different time zone and thought the 5 p.m. was on their time zone. So I just want to give you guys, that's like what we're facing right now, where we've had to go through and look at how we word things and our plans to try to not get those rejected, unfortunately.
Yes.
They are being very specific in the language that has to be signed by our administrators on complying with the executive orders related to DEI that are not, but still following, anti-discrimination policies and laws. So it's it's tricky to navigate what exactly they're saying by that, but I just want to share that's what we're all facing right now with our plans this year.
Yeah, HUD has been throwing down, like we get notifications or we hear about a notice that was sent to another CoC and they'll screen share that we don't receive. And so, for instance, July 3rd, we received a notice that there's a special NOFO coming out. Not much more around it other than, it hasn't dropped yet, but it's around for transitional housing and outreach. And so as soon as we hear more about that, we will definitely be sharing. But we're trying to keep a pulse on all of that. And I'll add, the bill that was signed into federal law on July 4th, that did not directly impact housing because that, as Arrow just explained, we're looking like July 14th. Some reviews around THUD getting together, reviews around THUD appropriations. But the bill that did pass and was signed into law on July 4th did cut around some safety net programs, around $1 trillion worth. So when we talk about Medicaid or SNAP benefits, food stamps, and we think about the Alice reports. So go to United Way Suncoast. They have a great for our area in Pinellas County. You can go county specific and look at people who are at that 80% AMI, area median income, people who maybe in other times in our lives may have been doing okay or not doing very well right now. When we look at housing costs, healthcare costs, food costs, and wages, and how that's not really kept up, this $1 trillion impact on that social safety net with Medicaid and food stamps being major, one of them are going to impact our people and make it harder. And it's going to add more people that are who may not have experienced as much hardship into the pool of people that we are really going to have to serve to. And so just keeping a pulse on all of that and how these ripple effects can happen based on these policies. So I know. So Errol mentioned, ESG, the state block grant. I will I will throw out my optimistic view of one thing. We did receive a 3-year contract with DCF. With increased funding and there will be a request for applications coming out very soon from HLA, and we are strongly encouraging, we will do as much as we can to support providers to apply for those funds to go through the process, review and rank, and get these funds out there and moving. Right now, because of the last minute nature of when we received our contract, we decided to maintain those current projects that we already subcontract with, and at the levels that they were able to spend down last year at a minimum, so that no services would be disrupted. Any subcontracts are going out, and anything that's executed by the end of the month can be retroactive to July 1st. So that's just to try to keep things going. We were able to, because of DCF funding and because of the CoC plan, the way that the priority interventions that were passed broadened this year, and that has an impact on what we can actually, what types of projects we can fund through DCF funds. And so that has been expanded. And that's going to be, so that's not optimism. That is what it is right now. The optimistic thing is that if with these block grants, what's floating around in the federal government right now is turning the CoC program into a state block grant, and a lot of talk around doing away with longer term housing assistance and focusing more on those, 2-year caps, emergency solution grant style programs that are more crisis driven and short term. And we know that we have people who need longer term needs and need that assistance. So permanent supportive housing. I've read some things that come around that, okay, senior citizens and people with disabilities may be exempted, but we can't just rest on our laurels and expect that that's going to happen. I will say it again. Permanent supportive housing, anything we can do to help. We have been, Kathleen and I have been reaching out, and I know others reaching out to elected officials, especially at the federal level, cannot get in. I know other CoCs are having some issues with that as well to get a meeting. And so we've been working with adjacent groups, like veterans groups and seniors groups, to try to come in that way, talking with Chamber of Commerce contacts to try to, hey, please, when you go and you meet with your official, please raise up the impact and the importance of these funds and this program, that it's coordinated locally with local oversight and affects our providers who are small businesses as well, and that we are in the best position to know what we need here in our county. We're not Orange County. We're not Pasco. We're Pinellas, and we're different. So I think we can accept that. So any chance that getting, if you have a connection with the politicians, the decision makers, to come and tour those permanent supportive housing sites, show the work, let them see what happens, let them realize that people who are there, it's not always permanent. That may be misconstrued a bit, and the people who are there do contribute through their earnings and in other ways. And so making sure just to language it in a way, give the message for for people who are outside our own bubble, who don't use our own language. So that it just makes sense.
Kevin wanted to add something, Sherry? Go ahead.
Well, I just wanted to put Sandra on the spot, but she's already got her hand raised as the president of the Florida Supported Housing Coalition to, talk about, what's being done at that level, as it relates to this critical issue.
Go ahead, Sandra.
Okay, so well, I will respond to that, but I was just cheering on Sherry because I was like, right on, that's exactly what we have to do around supportive housing. But yes, from the Florida Supportive Housing Coalition, we're extremely concerned about the direction in which HUD in the current administration is going regarding long-term housing that we know is extremely effective at keeping people at home, living with dignity and with the services that they need. And we have been advocating along with our national level counterparts. And I think we all need to do more of that, especially now that we know that the trend is there, that what the president asked for gets passed. And I think while it goes through committees and appropriations, there's opportunities to help tweak it. I want to be optimistic and stay positive. And I think that one of the things this CoC can do is in considering the, contingency planning is really hard given that HUD truly does provide the most financial support to providers who provide supportive housing. And as those of you who provide permanent supportive housing know that it really just takes a combination of service dollars to fund the services and rental assistance dollars to provide the operating subsidy for people who have extremely low to no income. And that includes people who only get a Social Security check, because most of them will not meet the threshold for straight affordable housing without a subsidy. So while we build affordable housing, unless we're really focused on the lower income, most of those folks aren't even eligible for that and without a subsidy. And I think those are the two areas that we're monitoring to see what the exemption would look like for people who are elderly and disabled, and whether or not how they will roll that out. As far as I understand, and this is coming from me as a provider of supportive housing, not from the coalition, but ESG and state block grants don't allow for more than 2 years of funding. So if they're going to merge those dollars into that, they're going to have to, in order to accommodate the exemption, they're going to have to do some changes in the regulatory requirements for ESG. But again, it's all so unpredictable and inconsistent. I think we're just really trying to advocate where we can and monitor, make sure that we all have full understanding of the impact. And then, advocacy, it's really hard right now to get people to listen because they're kind of on this trend that people are living off the government for long term, which we know is not the case, and that this is the most effective way of ending homeless for people who are vulnerable and at risk due to having a disability or elderly. So
thank you.
I wish I had more positive things to say about that, but that's kind of where we're all looking at right now.
And I apologize. The optimism, the only piece of optimism that I was going to offer here is that the way that the state of Florida is set up, the block grants, I'm not optimistic. We need to work on the permanent supportive housing side for 100%. But the way that Florida works is, as far as the CoC program goes, and the systems that we have in place, Florida privatized back in early 2000, and all their public funding, basically child welfare, behavioral health, Office of Home. DCF does not, I do not believe, will have much of an appetite for taking all of that work on, and will still be, divvying that out throughout regionally or by, CoCs. So I say that as just that one piece where, like when I'm talking with staff who are like, oh my goodness, I just heard, I was at this conference and COC program's going away. And it's like, let's put this in perspective to the state of Florida, and what Florida will decide to do may not be what other states decide to do and how they operate up. And in other states where the state operated all of that, managed everything. And so just something to keep in mind, but we do need to keep an eye on permanent supportive housing. And it would not, I would be preaching the choir if I just said, going into an ALF can't be supported. There's not enough beds. There are not enough inpatient beds. It's not the best place to be in a hospital or those types of settings. Just costs a lot more money. Number one.
Thank you, Kevin. Go ahead. And then this will be our last comment here. We do need to move on to our presentation. Go ahead, Kevin.
I just want to highlight really quick on this topic, some units that this group probably isn't even aware of, but is directly related to this as well. Like most people know about all these permanent supportive housing as it relates to COC dollars. But from the mid 80s to early 2000s, fully developed over almost 400 HUD 811 and HUD 202 projects that we operate today, which are for individuals with serious mental illness. So these are people, rather than coming through shelter, are coming through crisis units and other systems of care, still highly vulnerable, highly individuals. And HUD 811s and 202s are currently on a list of being eliminated. So in addition to all the PSH, there's supportive housing not under CoC. We have the largest HUD 811 in the state of Florida here in Pinellas County. So that's an additional 400 units that is funded under these initiatives that would be at stake here.
Would that be like in 2026, you'll see something? I mean, do you have any idea? What?
I think still, it's obviously still, this stuff's still going to get to Congress. There's a lot of things ahead, but you have to plan for all kinds of
what
alternatives. Probably the earliest would be 27. These transitions, but I don't know. Block grant without visions is going to be able to absorb.
Right. The continuing resolution that passed a couple months ago funds money starting October 1st. Okay. For HUD. So what they're just next week, whatever they come up with for that bill, will fund October 2026.
Right.
Yeah.
Thank you. All right.
So
thank you.
I know, Kathleen, can I ask one question? Or not ask a question, but I think what Kevin just shared, there are so many nuances to permanent supportive housing. There is the CoC part. There's also managing entities. DCF funds permanent supportive housing in many different ways. And of course, the 811 projects in 202. I think it would be really helpful because we talk about it at a very high level of what the impact of the cuts will be. And where I find it most effective in advocacy is when you can hone in Pinellas County. It is anticipated with the loss of these dollars, this amount of people will be at risk of homelessness that never were part of the CoC before. And I think that if we were to better understand overall that each of those programs as like BOLI and others that are doing in Pinellas County, the loss of that funding would mean this. And I think that in those stories based on data and numbers really do have an impact when you go to your elected officials and say, when you vote yes, this is what you're voting for. Are you ready to stand behind it? In a very polite and diplomatic way, of course, but because I think it's very easy to say we're going to cut PSH, but people live in PSH. And I think it's really important that we hone in on, the loss of 400 units to very successful and longstanding safety net programs for people with disabilities would be devastating.
Thank you. Yeah, I agree. And Sherry has been working on that. We have sent out, I don't know, at least a month ago, 6 weeks ago, a request to meet with our federally elected officials. We've invited them to take a tour of PSH and different providers here. And we have not had any positive responses, zero. And so that doesn't mean we don't continue to work on it, but, the last thing that's under this thing is lobbyist, collaborations, and I would just say, if any of our entities who sit on this board, and I know Clearwater has both a federal and state level lobbying firm that they hire, but if Largo does, you know, if the county does, and there's a way for us to communicate with electeds at those levels through your lobbyists, we need to do all we can. So reach out to us, Sherry or me, if you can help make that connection. So more to come on that, but yeah, it is worrisome. Sam, I apologize. So we're going to move on to agenda item 7, which is the data presentation from Sam. And we have plenty of time. You're fine.
Sorry, I'm sorry.
Yes, oh, I'm sorry.
Yeah, I'm sorry.
Go ahead,
Before we
Emery.
go on, so one of the things, you know, it's very disappointing that you're not able to get a meeting. So I'm assuming it's Anna Polina Luna.
And Rick's done.
Okay, and Kathy Castor, which I'm sure will meet with you. Well, why not put out a press release? This is what we are anticipating is going to be
The impact.
happening in our community. These are the people that are going to be impacted. And to get some media attention, because if you get media attention, maybe you'll get a legislator that calls and says, well, we want a little bit more information. You know, as Sandra mentioned, you know, the data with the story. So we have the data from the pit count. I'm sure we have some stories from Providers Council. Maybe they're required to share stories in their reporting to HLA. Combine that, put it into a press release and say, this is what we are anticipating is going to happen in our community if we don't do something. And then have an individual, a veteran, a senior, a mother with children who are experiencing homelessness or who are in supportive housing, who are willing to talk about what it's going to be like. What was it like before we went into supportive housing? What is it like now? And how can we even think about what it's going to be like if we no longer can call this place home? We all have media lists. I'm happy to share my media lists. We have reporters that we work with that tell stories that are empathetic, impactful, accurate. And maybe that'll help get you to the legislators who you want to talk to.
But here's an even simpler way to do it. Show that public forum. We have advocacy committee. Colleagues do not like to be called out on the carpet publicly. Show up at meetings. Dallas County Schools, city council meetings. When you come and you have someone speak, and everybody is hearing what you're saying, you will have one person that will stand up to champion or advocate for you without having to do, because I know, you know, Kathy Castor will be more than willing to do those type of things. So for me, I would think something easier, but most impactful and effective would be one of the.
Yes, I totally agree, and there's usually reporters at those meetings
And
as
there
well. But it's Anna Paulina Luna and Rick Scott who are not holding meetings. Who you know, we were invited to her town hall at 12 o'clock in the afternoon, and her town hall was at 11 o'clock that morning. Right, so I was like, because I sent it to my whole board, I was like, all right, here we go, here's our tip, because I can't get a meeting with her either. And whereas we can get meetings with Kathy Castor, Gus Villarakas, even Senator Scott's staff. There is no meeting to go to with her to tell her. And she's you know, she is a very influential individual in the Freedom Caucus. So yes, but definitely going to meetings is going to help as well. Yeah, and having somebody that can speak eloquently to tell that story in 3 minutes. Sorry, Sam.
Go ahead.
I just wanted to, can I
Hold on just a second.
I'm sorry, I just dropped in the chat.
Laura Hunt, go ahead.
I was just gonna mention, I keep thinking about Senator Sibley's, he's the CEO of Florida now, and so it's working in this sphere to some extent. Couldn't that be accessed? And I know the sheriff is technically on our board, and so they're gonna be able to share information, and then they are clearly very
Connected.
and so,
Yeah, we'll continue to work on it, I promise. Go ahead, Sandra, real quick, because Sam's waiting.
No, this is quick. I just wanted to let you know, based on the prior speaker, I did just put in the chat an article that was in Miami-Dade Herald, I think 2 weeks ago, regarding the cuts of permanent supportive housing. I think that this was a great opportunity that Pinellas County could do a similar one in Tampa Bay. Like there's been a lot of news media on permanent supportive housing over the past year. If we could get that, whoever has the connections with those reporters, there's a story to be told, I think. And it had, I think it was a very well done article. It really showed the impact from the residents' perspective.
Thank you. All right, Sam.
Great, thanks for the opportunity. We'll talk about data. We've obviously talked about data a lot today already. One of the key things, we look at point in time count, that's point in time, one snapshot. HMIS data looks at data over a period of time and shows people who are in the system. So it's a different way of looking at the same population. Today, we're looking at Q2 data. Q2, sort of contrary to normal intuitive thinking, is the quarter we just finished. So the first quarter of the calendar year is Q2 of the fiscal year. And the comparison quarter is the previous quarter, which is the last quarter of the calendar year. We'll go 2 more slides up. Okay. Yeah, keep going. Great. No, keep going. Yeah. Okay, so looking at demographics, key point here, when we talk about racial disparities, we are talking about high levels of racial disparities in our system. As has been mentioned a couple times, when we look at the Black population of Pinellas County, that's 10 or 11% of the population. When we look at our homeless population, 40%. Ginormous disparity there. And then when we look at specifically at families that are at least one adult and one child, that's 70% Black. 70% of our homeless families with children are Black. 10 to 11% of our people in Pinellas County are Black. So when we look at the data, we're always looking at disparities for sure. We do keep an eye on our Hispanic and Latinx community. That's actually underrepresented in homelessness. Although when we looked at the school data, it's a whole different story. So they don't show up in the HMIS data at very high levels, but they do in the school data. Veterans pretty consistent. And what we're looking at in this data, there's some changes quarter to quarter, but overall it's really a story of stability in terms of those numbers. Let's move up to gender. Great. Fantastic. So again, when you look at the client base for the homeless population as a whole, very strong majority male. But again, when you look at families with children, again, it's more women. That sort of, I'm sure that squares in the programs that you all work into, your family-centered programs. We have a lot more single women raising kids than single dads raising kids. So that's that piece of it. And again, what we look at here with the age, 30% of our clients in the homeless system of care are age 55 or over. That's a lot of older adults who are homeless. And what we see, interestingly, what we saw in the PIT data is that when you break down the homeless community from sheltered to unsheltered, the degree to which people who are 55 and over are homeless are even more so in the unsheltered population. So not only do we have too many seniors who are living without permanent housing, we have a higher percentage of people who are unsheltered and homeless who are seniors. And that speaks in a lot of cases to the fact that our shelters are not well set up, particularly emergency shelter, which drives all of this data, are not really well set up for people with medical needs, mobility challenges. So a lot of times those folks are not meeting criteria to be in shelter, which means they're on the street. That's not a good situation, obviously. So looking ahead to, and again, like when you look at this data, we really struggled on how to show this with the dashboard. I'm so grateful for our HMIS team. They've run through like 15 different model iterations with the committee to see what's readable here. You can see that the way this data shows it, you can see how it skews older, but it's even worse than it looks because most of these blocks are 10-year age groups. But when we wanted more granularity with the senior population, so the second largest block is only 6 years of age. And this is 3 years, 62 to 65. And that's still over 6.5%, or just in that 3-year age range. So the senior population is really a continuing concern about how to serve these folks and serve them effectively and safely. Let's take a look at length of enrollment. Again, here, what this really helps us get a sense of is how long people are staying in programs. When I keep coming back to the deep dive we took on the Safe Harbor program a couple of years back, and I'm really grateful because this is actually a success story that we're seeing because BOLI and Safe Harbor are partnering to think about how to wrap services more effectively around these folks. Emergency shelter is the biggest single program in terms of entries and exits, so it drives a lot of the data that we're looking at. Folks stay in emergency shelter typically 64 days, but you can see that is that's based that means there are a lot of people who are staying a day, 2 days, a week, and you are not able to get somebody housed if they're there for 2 days or a week. It takes time to get somebody housed. And that's where the strong case management, strong interventions within the shelter population and making sure people can get those services. Permanent supportive housing, again, is always a huge area of success for us. So when we talk about potential cuts in that arena, it's particularly scary. Kevin's really articulated very well that for permanent supportive housing to be effective, what that means is braiding resources together over time. These are brick and mortar facilities that take a ton of planning from the time that it's conceived on paper and funded to the time it's built. And what makes it successful for people is that it's extremely vulnerable people who are there for a long time. It is permanent and it's supported. And those things are really important. So that this tract is really just showing that length of enrollment. The other key point here is that when we look at rapid rehousing, which is probably the key intervention for getting people who are on the street now to permanent housing, key intervention, people are staying in those programs for longer, largely because it's harder to place people because the cost of housing is high. It's hard to find people a place to stay. So there's a significant increase in length of time in that program. Let's look at exits. So exits to permanent housing, we can see not many people go from emergency shelter to permanent housing. Again, the length of stay is short. It takes time to get people housed. It's difficult. And the successful exits within rapid rehousing decreased from last quarter to this quarter, which again points to the challenging housing market. Key intervention, it's something that needs more investment, and it's an ongoing challenge for us. Homeless prevention, again, we talked earlier in the meeting, prevention whether we're talking about healthcare or we're talking about homelessness, it's better to prevent something than to address something. So the more we can get people to stay housed, the easier it is to keep them housed, rather than treating the problem once they're already homeless. Let's look at income, but we'll look at that briefly. This is a really hard graph to say. I'll say these dashboards are online, so I really encourage you to take a look if you ever want to get deeper into the data. It's really neat that you can sort of look at different populations that are particularly interesting to you. You can look at this data broken down by intervention type if you want to see how our different programs are doing. That's really how you come to understand this data, is by spending some time with those dashboards. But the point here is that income is really a challenge. We see this every year in NOFO because one of the things that we look at is how programs do at getting people income. People cannot sustain housing without income, and a lot of our folks have multiple challenges to employment income. And if we look at safety net cuts, that's additionally concerning. We did see that our rapid rehousing programs did have some success 17.5% of their clients increased employment income. So that's potentially a good area to look at. How do we weave in our job readiness programs and supported employment programs? Let's take a look at the acuity here. So we're looking at, as all of our providers know, and all of us who have done PIC counts or whatever, the folks that we're working with have high levels of need. Most clients and many of our interventions come in with no income at all. And many of them are coming with multiple disabilities. So, you know, it's when you look a little more specifically, you can see that, you know, the more than one disability that's at the bottom, obviously most people who are in safe haven, 2/3 of people in a safe haven have more than one disability. That's actually probably underrepresented because to be in a safe haven, almost everybody has more than one disability. And again, I think this points to the challenge of getting people to really understand and feel comfortable sharing all of the things that they're carrying when they come into our programs. Let's look at acuity. Again, this is looking at VI-SPDAT and VI-SPDAT scores. So these are how we score people for their vulnerability and choose what the best intervention to place them in is. One of the stories that we've been talking about as long as I've been in the continuum of care is that there's not enough permanent supportive housing for everybody who needs that intervention, which means that people with very high levels of need are being served in rapid rehousing, which is really a more appropriate program for people with a score of more like 5 or 6. We're looking at people who are at a score of 7 or 8 for vulnerability. They're harder to serve in that population, which means it takes more case management and more likely to return to homelessness. And when we're talking about returns to homelessness, we've seen a couple of areas where we have had some increasing returns to homelessness, particularly permanent housing, not permanent supportive housing. There's some in permanent supportive. But the challenge here, when you look at permanent supportive housing, there's a big change here, but that's because there are very few returns. There are very few exits from permanent supportive housing. So small changes can show up pretty big quarter to quarter, and that's not really representative of a big change. Similarly with transitional housing, it's a small program, so small changes show up as changes here quarter to quarter. But the return to the emergency shelter always has a pretty high rate of return, and rapid rehousing had an increase in returns to homelessness. So again, that looks at the complexity of some of these folks and the need to wrap robust services and robust prevention services again around folks who are coming into our system. So that's the data for this month. I'm really grateful, particularly to Amani, but also to all of our HMIS staff for giving me a great set of talking points to work from and helping us to understand the data together. Happy to answer any questions that I can. Yeah, please go.
Thank you. I would just comment on even the increase in income, because we live in such a service industry, it's still hard for people to make enough to find housing that's really not there. So some kind of subsidies or, we need to think differently, I think, for people who are working even 60 hours a week.
That's absolutely right. Are there any questions on that?
Appreciate being walked through that. Thank you.
My pleasure.
Found it on the website as well.
Great, thank you.
Yeah, no question. Yeah, the dashboard. Dashboard was shared in the chat.
Great.
So yes, it can be found on our website.
Great. Thank you all very much.
Thank you, Sam. Thank you. Okay, Sherry's gonna give us some updates on the lead agency, the HLA.
Yes, and in the interest of time, much of what I would be sharing, I previously shared earlier under the funding and legislative updates. And so I'll jump into the areas that weren't covered. For the CEO search, that has been, I was appointed, my appointment was extended 180 days, so through December 4th, while the HLA board continues to try to create conditions to help stabilize that position before going permanent with it. And then finally, there are upcoming opportunities. We have some trainings on domestic violence coming up. There's a membership meeting in August and a summer health fair hosted by Pinellas County Human Services. All of those they're hyperlinked on your agenda as well as on our calendar at pinellashomeless.org and the CoC website as well. So just wanted to shout out about that. And then since we have 5 more minutes, I figured it'd be good to allow for us to have some public comment, if that's okay, unless there are any questions.
Any questions? I will say Sherry's been doing a phenomenal job and things have improved significantly, and we are rowing in the same direction and working well and making progress, and it's improved significantly. So I appreciate that.
Right, I appreciate
Any
you,
public
Kathleen.
comment from the group or online? Anything online, Nancy?
Nothing yet.
I have under the call to action. So, you know, I hope that everyone who serves on the board and who's a general member will choose to join a committee. We really need you in any of the committees that speak to your heart or that you have capacity for. Your voice will be appreciated and welcomed at the table. I would encourage all of our board members too to try to attend one of the LEAK Lived Experience Advisory Committee meetings. They're held monthly. They are an hour and a half, 5:30 to 7, right? They're very informative and they're well run, and it's the reason we're here. So I would encourage you to do that. I would also encourage you to plan to volunteer at a hurricane shelter or, you know, listen in on those meetings that will be upcoming, cold night shelters. There's nothing better than working with boots on the ground in some way. Those of you that are providers and others are out there every day, but if you're not out there every day, try to get out there a little bit. I would strongly, you know, I'm thoroughly impressed with those recommendations that Freeman put in the PIT report, and I think it's going to be a great starting point. And as we talked about getting together, you know, getting providers to weigh in on what we're already doing, what we can expand, all that stuff, there's phenomenal potential with those recommendations, both short and long term. And realistically, we can't do everything, but it's a great start. And I'll follow up with Freeman. You know, when he wrote those recommendations, I'll follow up and then send out an email to you all. Does he have a group that he can direct us to that's already doing some of those things that we might not be doing, that we can, you know, engage with, contact with, model from? So I'm going to do that. And then, you know, elected officials need to report back about what we've done at this meeting and the talking points and share what's going on. Because really it's about funding. We need funders to know what we're doing, and we need continued support, and we need expanded support. And we are showing progress in the PIT report. And so we need to continue that. Yeah, Deborah.
Thank you. Before you adjourn the meeting again, and thank you for that. And I am blessed from the city of St. Petersburg that we have Amy Foster and Adrian on staff. So I don't have to do a whole lot of reporting. We have some real hand holding with that. But again, before we adjourn, I didn't have the opportunity to again thank Mr. Cook. You have been phenomenal the whole time I have been on. And I'm saddened to hear today that today is your last meeting with us. So again, I want to thank you. You know, you kept us together, your professionalism, your organizational skills, all of that we needed to continue to move forward. You provided that for us. So I don't know where you're going, but wherever you're going, they are truly getting a valuable asset. And then I also wanted to thank everybody that's here today. Today we had a really good representation of CoC. we've had thank you, Dr. Hines, for being here. We've had a great representation because so many times, and we're gonna talk about it in the executive committee meeting, we keep talking about how do we get people here to these meetings, and today was a good, representation of that. Yes, we do have, a little bit further to go with that, but as an elected official that drove all the way to Largo, I'm grateful for those of you all that are here and continue to do the work every day, because again, it is a true partnership, because elected officials, we don't know what we don't know. But we really do appreciate those of you that do, and to keep us first with what it is as to how we feel. Thank you, ma'am.
Thank you very much.
Yeah,
So, go ahead,
I would be
yes.
remiss if I did not include my dear friend here, Miss Arrow Woodard, and how lucky Largo is to have her and keep all of us blessed.
She is wonderful.
She's amazing.
Yeah, we have really good leaders. Go ahead, Victoria and Megan.
Hey, while we're acknowledging people, I'd also like to acknowledge Arrow and Dominique, who is no longer, oh, she's still on the line with us. Dominique has been the chair of our point in time planning committee for the last 2 years. Arrow served as chair a few years ago and has been such an important part of that committee. So today, as we wrap up the 2025 point in time count, I wanted to acknowledge both Arrow and Dominique for their incredible leadership, and the Pinellas County BTS team. They are the IT people and the people who made that map that you are going to see, the dashboard, all possible, the digital survey possible. So I just wanted to thank everybody for that work. Thanks, everybody.
Mr. Ross Silver,
Ross, go ahead.
Yeah, just echoing a quick thank you to Victoria for your countless hours of service and positivity and passion for this. So all the best to you.
Thanks, Ross.
We do wish you all the best. I'm excited, and I know you'll be around. Yep, it'll be good to see you still.
Won't get rid of me that easily.
All good. Thank you. All right, with that, this meeting is adjourned.
Thank you.
Thank you very much for coming. My executive members and on here. Oh, for